Good afternoon, ladies and gentlemen. I will call the State of Nevada Executive Branch Audit Committee meeting to order. Happy New Year, everyone. All members are present with the exception of Ms. Cross, who is excused. We'll move to agenda item number 2, which is public comment. Is there any member of the public present in Carson City that would like to provide public comment to the board? I hear and see none. Is there anyone present in Las Vegas that would like to provide public comment to the board?
None here, Governor.
All right, thank you. And Ms. Lieutenant Governor, can you hear us loud and clear in Las Vegas?
We can, thank you.
My thanks to Buildings and Grounds. We got it. Remember that last time? Yeah, all right. So good job, guys. Yeah. All right, we'll move to agenda item number 3, which is the approval of the June 20, 2017 Executive Branch Audit Committee meeting minutes. Have the members had an opportunity to review the minutes, and are there any changes? If there are none, the chair will accept a motion for approval.
Move to approve.
Attorney General has moved to approve. Is there a second?
Second.
Second by the Controller. Any questions or discussion on the motion? Hear none, all in favor say aye.
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 Those opposed say no. That motion passes unanimously. We'll move to agenda item number 4, which is the presentation of the division's audit reports pursuant to NRS 353A.085. First is the Department of Corrections report number 18-01. Good afternoon.
Good afternoon, Governor, members of the committee. For the record, Ashwini Prasad. Representing the Department of Corrections is Deputy, hold on 2 seconds. See here. Okay, good. Representing the Department of Corrections is Deputy Director John Barrowman, Chief of Fiscal Services Scott Ewart, and Deputy Director David Tristan in Las Vegas. At the request of the committee, we reviewed NDOC's overtime management at its correctional facilities. Overtime at NDOC correctional facilities has increased by an average of over 30% a year for fiscal years 2015 through 2017, but the inmate population has only increased an average of 2% for the same period. Examples of overtime issues we noted are one correctional officer at Southern Desert, which is one of the 4 correctional facilities with the lowest vacancy rates, was paid $97,000 in overtime, with a total compensation of over $150,000, compared to the second highest correctional officer, who was paid $42,000 in overtime, and also compared to the remaining correctional officers, who averaged $7,000 in overtime in the same facility in fiscal year 2017. We also noted, based on our sample, 20% of correctional officer timesheets included instances of leave taken and overtime worked within the same work week. For example, a correctional officer used leave for 8 hours and subsequently worked 8 hours of overtime at time and a half on the same day. We believe better overtime management would address these issues and may help reduce costs for the department. In general, overtime hours should equal vacant position hours. However, our audit found a discrepancy between what NDOC paid in overtime compared to vacancy hours at its correctional facilities. 4 of 7 NDOC correctional facilities are almost fully staffed with a vacancy rate of 4% or less and are located within urban areas with access to a large employee pool. Yet these facilities pay the most overtime compared to the rest of NDOC correctional facilities. Most of the facilities either paid overtime in excess of vacant position hours, some upwards of 600% of its vacant position hours, or did not incur enough overtime to cover its vacant positions. Some overtime is for hospital coverage, which NDOC is not adequately staffed for. However, other overtime is for covering vacancies and holidays that could have been accounted for during scheduling to avoid overtime. Our comparison of average overtime hours per correctional officers shows Florence McClure Correctional Facility in Las Vegas has the second highest average overtime hours per correctional officer, but has the lowest vacancy rate of 2%. Florence McClure in High Desert paid approximately 40% of overtime for hospital coverage, compared to the average of other facilities of 10%. We offered 4 recommendations to improve management of overtime for correctional officers. First, we recommend NDOC schedule overtime eligibility on hours worked, not on hours paid. Our sample testing of correctional officer timesheets showed 20% of each work week included instances of leave taken and overtime worked within the same work week. For example, in a standard Monday through Friday work week, a correctional officer has leave on Monday, work Tuesday through Friday, and work Saturday at the overtime rate of time and a half. Had NDOC scheduled someone who had not taken leave or had not worked 40 hours, NDOC could have avoided paying 4 hours of overtime. Currently, correctional officer schedules are not finalized until 2 weeks prior to being effective. Longer-term scheduling may offer more visibility on staffing needs to effectively schedule correctional officers to minimize the use of overtime, specifically in Southern Nevada, where 3 facilities are near full staffing levels. Longer-term scheduling may benefit NDOC by up to $1.4 million by avoiding overtime at the fully staffed facilities. Secondly, we recommend NDOC establish a strategy to encourage increased number of overtime volunteers, including conducting a Division of Human Resource Management, or DHRM, climate survey to help reduce the amount of mandatory overtime and create a better work environment. We found 7% of correctional officers are receiving 23% of total overtime pay in fiscal year 2017. NDOC states the 7% of correctional officers are those who volunteer for overtime. The remaining do not and are assigned mandatory overtime when deemed necessary. NDOC practices may contribute to the low number of volunteers for overtime opportunities, as the best shifts are given to the most senior correctional officers and the least desirable overtime shifts are left for junior correctional officers and non-volunteers. A DHRM climate study could help determine why 93% of correctional officers do not volunteer for overtime. Third, we recommend NDOC reassess staffing to determine appropriate correctional officer needs at each facility. We realize the challenges NDOC is experiencing hiring correctional officers in the rural areas. We realize the challenge, Ely and Lovelock correctional facilities have the highest vacancy rate, although they paid the lowest overtime hours when compared to vacant position hours. If NDOC's vacant authorized correctional officer FTE positions in Ely and Lovelock may be overstated by 25% and 43% respectively, which could benefit NDOC by up to $576,000 by eliminating or transferring positions to other facilities and help reduce overtime. Lastly, we recommend NDOC implement part-time and critical needs correctional officer positions for hospital coverage and other needs to help lower overtime costs. Capitol Police initiated a 3-pronged strategy to meet its peace officer requirements and to eliminate use of overtime payments. Private security officers used during non-business hours, part-time positions that are not full-time equivalents, and critical need positions manned by employees who are full-time equivalents. These are, in general, Nevada retired peace officers seeking to supplement retirement pay without working a full-time job. This strategy allows Capitol Police to take advantage of a non-traditional workforce available in Nevada and reduce overtime pay by approximately 20%. A similar strategy in NDOC may help lower growing overtime costs in the state's correctional facilities and provide opportunities for retired correctional officers to continue to use their experience. As an example, providing correctional officer security for hospitalized inmates was 18% of NDOC's overtime costs in fiscal year 2017. By implementing part-time or critical needs correctional officer positions for hospital coverage and other needs, NDOC would benefit by about $500,000. We appreciate the Department of Corrections' assistance throughout our audit and thank them for their time and consideration. This concludes my overview.
Committee members, any questions for the auditor? Because I actually want to hear from the department and its response to the audit. So any questions?
I agree with that. I want to hear from the department.
Okay. Mr. Attorney General. All right. All right. If the Department of Corrections, please proceed in its response to the audit.
Good afternoon. My name is John Barrowman. I am the Deputy Director of Support Services for the Department of Corrections. I appreciate this opportunity to have worked with the Audit Committee. They're very professional and ask a lot of good questions. I think that a lot of the perspective, what appears to be very flagrant, I'm hoping that we can work through the nuance of the business and be able to understand some of the limitations on this. The audit was on the overtime, and there are continuing scope of that in other areas, but we're here to talk about the overtime specifically today. One of the things that is important to understand when we're talking about the department is we are budgeted to do activities within the Department of Corrections. That includes not only the incarceration, it also includes programming, it also includes medical, the full scope of what it would take to be a host for an individual in our responsibility. One of the things that has been very problematic for the department is we are not budgeted to do all of the things that we are required to do. For instance, if we have an inmate that it requires imaging or some type of outside service, we must transport 2 officers with that inmate to drive them to the outside medical provider. We cannot just tell the inmate to drive themselves. However, we have very few officers actually dedicated to the transport of inmates when they go see an outside provider. In fact, there's less than 20. And on any particular day, the High Desert State Prison could have as many as 60 involved with transporting inmates to outside providers. Well, where do the other 40 officers get funded? It's on overtime, because we do not have a position that is legislatively approved to support the workload of transporting all of those inmates to outside providers. Additionally, if we take them to the hospital and the hospital staff determines that they require being admitted into the hospital, then we must have coverage at the hospital in order to make sure, we just can't tell the inmates, please don't run away. We must be in the hospital room with the inmates. We have less than 20 officers that are legislatively approved to watch those inmates in the hospitals. Yet Florence McClure had, at one point, 12 ladies in the hospital because they were pregnant and expected to deliver. 12 inmates were admitted to the hospital. For each person that is admitted to the hospital, we have 2 officers for 8 hours. We have 3 shifts of 8 hours. That's 6 officers per inmate, times 12 inmates. We had 72 officers at the hospital watching the inmates, and Florence McClure was budgeted 4. Not even enough to watch 1 inmate for a 24-hour cycle. So where does the other 60-plus officers come from? Unbudgeted overtime. And if you look at the top driving reasons for overtime in the Department of Corrections, it is for medical transport, it is for hospital coverage, and it is for vacant posts. We have clearly got a problem with vacant posts, not only with our vacancies, but also with the way that we collect the data on overtime. For instance, if there is a guard tower that does not have an officer in that guard tower doing that function, the sergeant will call someone in on overtime and say, I need coverage in the guard tower. Now, we try and make sure that the officer understands the reason why he's providing overtime coverage in the guard tower is because the person who's supposed to be in the guard tower is driving an inmate to the doctor or stationed at the hospital to watch the inmate. But the person that provides that overtime coverage doesn't always get that coded correctly on the timesheet, and so therefore we don't have the best data possible on why we have vacant coverage. It isn't always because of a vacancy rate. It could be because the post was vacant, and that's what the officer, in his best effort, marked on his timesheet. The reality is a substantial portion of that vacancy post is really allocable to providing coverage for training, providing coverage for medical transport, providing coverage for hospital admissions. So, and then also we do have vacancies. As I mentioned, we are closing the gap on the vacancy issue, but some of those facilities with the large overtime, particularly Ely and Lovelock had low overtime but high vacancies, and then Florence McClure had low vacancies but high overtime. It's because of the nature of the inmate and their location to medical services. We try not to run people to an outside medical provider out of Ely because the transport to Vegas and back is very problematic. So when we know that an inmate is going to require medical services, we try and relocate them temporarily to the High Desert State Prison. Therefore, High Desert State Prison, having a medical facility in its area, can try and treat them, but where it requires outside services, High Desert State Prison has a disproportionate share of inmates going to the outside medical providers, and therefore has a disproportionate share of the overtime. I don't get the luxury of moving the female prisoners at the Florence McClure Women's Correctional Center to any other prison, and therefore Florence McClure is solely responsible for all of the medical transport for the inmates that are in their facility. And while they are approaching full employment, the reality is the female inmates require more medical services than a male inmate. Not discriminating, just speaking the statistics. And so Florence McClure is burdened with more overtime to provide these services that are unbudgeted, but yet are required to provide. So if we understand that that is a foundation for our budget, and that is we have services that we must provide, but yet don't have positions to provide, we understand that we are going to incur overtime to provide those services. Those service levels are very unstable. In one particular month, Florence McClure had 1.5 inmates per day on average at the hospital. On another month, they had over 25. And so assigning FTE to it is oftentimes problematic. But inherently, the best value of the state is at some level you're going to have permanent positions, and at some level you are going to have some overtime services. So if we understand that business, I'd like to go through the particular recommendations and see how this ties in.
Well, before we do that, why don't
Yes.
we start with a few questions? So do you take any responsibility for
Absolutely.
this problem that we have?
Absolutely. In the agency request and the GovRec budget, we did ask for additional positions. We asked for additional positions specifically for transporting inmates and to provide this medical coverage. Unfortunately, it didn't make it through session, but we understand that continuing to provide this service on unbudgeted overtime is problematic.
So those positions were originally included in the executive budget, correct?
Yes, yes, sir.
And the legislature didn't approve those?
Yes.
Because I mean, right now the department is $15+ million over budget. I mean, it is not even close to any other department. And, we're in the midst of a plan here, but this is a problem. I mean, I'm just kind of stating the obvious here. But, so what happened during the legislative session where you weren't able to make the case that those transport positions weren't necessary? Or weren't it?
Thank you. John Barrowman. The discussion went something like, we have a lot of vacancies, and what's the point of giving us more vacancies? The reality is we were asking for positions for NNCC up here in Carson City and High Desert State Prison down in Las Vegas. We are approaching 0 vacancies at those facilities. When I say 0 vacancies, I should say that a natural vacancy rate in our industry is around 5%. Anything less than that is unnatural. Anything less than that is an extensive focus of resources to get below that. But due to the nature of our business, it's generally around 5%. We are less than 5% vacancy at High Desert and less than 5% at Northern Nevada. There wasn't an extensive discussion about that. Instead, the comment was, if we can't fill the vacancies we have, what's the point of giving us more vacancies? It would be one thing if we weren't trying to make some improvements to our vacancy rate, but the GovRec budget included a 1-grade increase for our correctional officers. It also, the competing agencies were also anticipated to reach fuller employment during this fiscal year. And both of those things came to fruition. Both of those things have been very positive for our recruitment rates. So our vacancies have gone down to functional levels, and we could have benefited from additional positions in those facilities had they been approved.
Okay, well, let's move on to these, and maybe you're going to talk about this, but these internal controls with regard to some of the correctional officers taking comp time, and then in the same week, being able to stack some overtime on top of that.
Thank you. John Barrowman. If we think about, are they gaming the system? Are they using leave that would be discretionary so that they can trade it with their buddy and, you know, both of them would be paid overtime? You cover my shift, I'll cover your shift, we'll both be paid overtime for the same amount of hours. The department already has in place that if you have any sick leave in a pay period, that you are ineligible to perform any overtime for that pay period. However, annual leave is unlike sick leave. Sick leave, we allow you to accrue as many hours as you want. We never force you to use it. And in fact, we even give you a financial incentive when you retire for unused sick leave. There's a ratio for that, but we incentivize people not to use sick leave. In the case of overtime, or in the case of annual leave, we say you cannot carry more than 240 hours. And if you do not use your 240 hours, you will lose your 240 hours. So we put a limit on how many hours an officer can accrue. If that's the case, then an officer must use at least as much hours as they accrue that year if they're at the upper limit. And if we're telling someone that you should not use your annual leave so you are eligible for overtime, then they defer their annual leave. And then it creates a big problem towards the end of the year when everyone's trying to burn their leave. And oh, by the way, if they burn their leave at the end of the year, then who's going to volunteer for overtime that is still eligible? Instead, what we've done is we've said, use your annual leave for the entirety of the year. And one of the recommendations talks about no long-term scheduling. The reality is we allow them to bid their shift in December so that they know what their shift is for the next 12 calendar months. And at that same time, we ask them to submit their annual leave so that we know that it's being used throughout the years. And we do deny annual leave when it exceeds the amount of coverage that we have available. So we are forcing people to use their annual leave for the entire calendar year. Now, if someone works Monday, Tuesday, Wednesday, Thursday, and then they're off Friday, Saturday, Sunday, Monday, and then they work Tuesday, Wednesday, Thursday, Friday, it would make sense that they would try and have annual leave towards their long weekend to extend that. So if they were to work on a Monday and they claim annual leave on a Monday, we want them to do that. We want them to use their annual leave because not only do we want them to, they have to use their annual leave in the year or they lose it. But towards the end of the week, when they're no longer on vacation, why would we make them ineligible for overtime? Why wouldn't we allow them to work the following Friday, Saturday, Sunday, Monday that has absolutely no relevance to the annual leave they took 4 days earlier? So yes, there is a period of time where an employee could take annual leave and receive overtime in the same week or pay period, and we feel that that is still legitimate. Now, if someone is going to call in sick so their buddy can do it, we already prohibit that. But if someone's going to extend their vacation through Monday, and then we find out that someone calls in sick at night, why wouldn't we allow that employee to come in on a different shift and work that overtime? They're entitled to their annual leave. How they spend that annual leave is completely irrelevant to us. We force them to use their annual leave, and so we feel that in order to maximize the number of people that are willing to volunteer for overtime, we don't believe that annual leave is an excluding criteria.
No, and I guess I understand your philosophy, but the state's not an ATM either. So you're $15 million outside of your budget right now, and on track to be $22 million over your budget in the first year. So it's nice to have that policy, but you don't have the money. And where's the state supposed to find that money? Because right now, it will completely deplete the contingency fund, 100% from one department. So it also begs the question, why in the first 4 years we had overtime, but not even close to the degree that we have it now? So what has changed? Because we've added positions, we've added salary. So why is it so far out of whack now, so far out of control?
I understand. John Borrowman, we have seen a substantial increase in the number of Medicaid days, 1,500 increase in Medicaid days, each of those requiring officers to provide coverage. That is above the base year, that is above our historical, what we've had in the past. We've also made a progressive move towards preserving the programs, the education, the visitation. Our reaction in the past in order to eliminate overtime was if someone, for every officer, they had to be on the road to transport an inmate to an outside medical provider, we would compromise some of those other things that we were budgeted to do. And over the last, since we've had this new director, we're really trying to push the programming, the rehabilitation of the inmates, and those are competing interests. And so we've looked at our operations, we've tried to find ways that we could make concessions internally, and we do believe that we have ways to substantially reduce that overtime, that projected overtime, but they come at a cost. There is a consequence to not doing what we're supposed to be doing. And in the case of medical transport, we have many more visits now than we did in the past. Several contributing factors, but at the end of the day, we're responsible to provide the medical coverage that we are providing. It is a different experience today than it has been in the past.
I mean, I'm going to go to some others, but reading your response, my impression is it's just defiance and basically saying we don't know your business and that we know what we're doing and this is how much it's going to cost and you just got to live with it. But as I said, as it stands now, if we were just to say, okay, we agree, the contingency fund is gone, and then we have to find money in other places to make this happen. And so, and you'll have the opportunity to talk, we need a plan because you can't go on like this. I mean, we're physically incapable of doing that. And right now, as I said, the response, what I'm hearing is, you want a blank check. And we don't have a blank check. So I'll start down the line. I'll go with the controller and then move to the treasurer and then on to the attorney general and then perhaps the lieutenant governor.
Thank you, Governor. And Mr. Barham, I got a couple of specifics to try to drill down on this. Of the $2.5 million estimated benefits in this audit, the vast majority, about 58%, comes from recommendation number 1, schedule overtime based on hours worked, not hours paid. And that's the only one of these 4 recommendations on which your response begins, NDOC does not agree with this recommendation. I guess my question could best be put this way. What portion of that 1.443 million that is estimated could be achieved by this recommendation are you willing to take responsibility for and say, this is on us and this is something we need to do and can do? Any part of it? Obviously not all of it, but in view of your response, what portion of that particular recommendation really accrues to your management?
Thank you. John Barrowman. It's a difficult question, and here's why. The recommendation is saying that if you don't work the first 40 hours, that you don't get paid overtime. The reality is we needed the coverage. So if I was to exclude an employee who is volunteering to work 4 days later on the weekend, where normally he would be scheduled off, and I'm to exclude that employee from participating in overtime, it was not concluded that that coverage was unnecessary. And in fact, they agreed that the coverage was necessary. So if I exclude this person from volunteering to do that overtime, and I mandate someone else to do that overtime, did I save any overtime dollars? Or did I instead exchange a volunteer with a mandated person to do it? So the question is, by mandating an employee to provide that coverage instead of using a volunteer, how much money would I save for the same amount of overtime? If you look at strictly the math of it, there is no savings by refusing to use a volunteer and starting to mandate an employee. That inherently doesn't generate any savings.
So if I understand your answer right, you're saying that there's no portion of this 1.443 million that you can take responsibility for and say that you can make reforms that will reduce your costs by some portion of that.
If we're saying about implementing this particular recommendation, it would not generate any savings. If we're talking about, does management take responsibility for the overtime, and are they reviewing the general operations for opportunities? Absolutely. We had a meeting this morning to go over some of those possible options to make sure that they are feasible, but there are some proposals that we are considering in order to reduce this overtime that has a possibility of being much more than this amount.
Well, let me try to offer one recommendation, and this is offered somewhat innocently because I don't know all the constraints you operate under, but I've spent some time at local hospitals for myself and family members this last year and a half, and I've seen inmates and people who've been arrested who are in the hospitals areas there, and I think most of the time it was from the local jail. I'm not sure, but you could always tell because there was an officer there. But I don't remember seeing 2 officers cover someone who's been admitted to the hospital. Now, maybe I missed something. Maybe the local department has a different set of policies or needs or constraints than you do, but you tell us that for every 8-hour shift when somebody's in the hospital, you need 2 officers per inmate in the hospital that's been admitted. Is it possible that you could make some judgments and cut that down in some cases, maybe many cases, to 1 officer monitoring that inmate in the hospital?
Thank you. John Barrowman. I appreciate that. That is, in fact, one of the considerations that we have. NDOC handles inmate oversight in a hospital at a much higher security level than a municipality. There are arguments for and against doing that. Which one has the most risky clientele, et cetera, et cetera. But to your point, there is a difference between what a municipality does and what NDOC does with the inmates. We've looked at the history of it and what generated our current policy of 2, and we are reviewing that current policy, and that is one of the considerations that is on the table for us to impact this over time.
Thank you, Mr. Barrowman, and thank you, Governor.
Thank you, Mr. Controller. Mr. Treasurer?
Thank you, Governor. First of all, congratulations to the Audit Committee for what appears to be a fairly thorough. What appears to me is that it's constraints and regulations, which everyone knows about. Certainly the guards know about it. Probably the inmates know about it. And they, and I don't know in management who's responsible, but clearly it's just gone on far too long. And I appreciate that the work you do is dangerous and the work that the guards do is dangerous, but clearly someone seems to be taking advantage of what are good intentions to really feather their own nest. And I think the audit committee has been fairly restrained in their recommendations, but I think you really need a thorough overhaul of how you pay your staff. Thank you.
Is there a question in there? Mr. Treasurer, do you have a question? I mean, I'm not.
No. The question is, yes, I mean, do you think that the system is being gamed by the guards?
Thank you. John Barrowman.
It seems pretty easy.
Yeah. It would be naive to think that the system is not being gamed. I'm positive that there is collusion going on in order to generate schedules that would result in feathering one's nest, as you say. But at what point in time do we implement a policy that is harmful to the collective in order to address those that are gaming the system? How do you isolate those? How do you identify those? And we're reviewing the practice. We're reviewing the patterns. One of the things that we are pursuing, it was in the agency request, governor's recommended budget, and it passed in session, was to get a staffing scheduling software. Right now, we have a very unsophisticated software to allow us to do any analytics. And in our ledge-approved budget, we do have a staffing scheduling software technology investment request that was approved and funded. With that implementation, we will have access to substantially more analytics, canned reports, as well as the option for custom reports, where we will be able to identify some of these patterns that are more prevalent and try and handle those with the individuals that are doing this. From a policy matter, though, do we prevent a volunteer from performing overtime so that we would mandate an employee to work overtime and still incur the same mandated expense? Again, it was not determined that the coverage was excessive. The coverage was valid. What they found was, could we find someone other than a volunteer to have worked that overtime? Yes, we are looking at our policies. Thank you.
Well, if I understand the governor correctly, I think he's saying is you don't have a choice. This is you're 15 million on your way to 22 million over, and what's happening now it's just not acceptable. And I think you have to do more than just hope and wish, but it's just not possible.
Thank you.
Thank you, Mr. Treasurer. And just a follow-up, because I've heard looking and reviewing, but not acting. And, you know, I'm not a budget guy like you, but it's not real hard to figure out who's making all the overtime. Mm-hmm. We don't need software to tell us that. And so I'd like to see a lot more action now, rather than waiting for the purchase of software and the implementation of software to tell us what we already know. And because I can't be any clearer, you can't go on like this. I mean, there's a room full of other departments, education, health and human services, I could go on, that have needs, and you're gonna wipe it out. Gone, 100%. And if they have some type of a contingency that happens, we'll have to call a special session because the Department of Corrections is over $22 million in a year. I mean, that's what we're looking at here. And it's scary. It really concerns me. And I don't feel a sense of urgency from your testimony. And that's what concerns me the most, is that we're at this point now. I mean, it's that zero moment where the ship sinks or it stays up. And right now I see it sinking. And so I would like to see more specifics in terms of, we're doing this right now, we're doing this tomorrow, here's our plan. I haven't heard a plan. We're studying, we're reviewing, we're looking. That's not good enough. Mr. Attorney General.
Thank you, Governor. I hate to pit you all against them, but I will ask a question. Is this principal rebuttal, I mean, do you all accept that? We haven't actually come back to you and give you the opportunity to say whether you agree or do not agree with their statement.
Thank you, Attorney General Laxalt. For the record, Steve Weinberger. I will say that we agree that we did not find these shifts unnecessary, but what we did find is some of these facilities are at a 4% vacancy rate or better, and our thoughts are there's got to be a way to do some better scheduling to decrease some of the overtime hours that we experienced. Specifically, the one person that we singled out works at Southern Desert, and Southern Desert is 4%, so it's basically filled up. You know, that's, I think you were saying that 5% or less is almost abnormal for a correctional facility. So we understand there are some major challenges for places like Ely where the vacancy rates are higher than normal. But at these locations that are about 4%, usually next to a big labor pool close to Las Vegas, we're thinking that with some better scheduling, there should be a way to cut down on some of that overtime.
Okay, thank you. And then a few questions for you all. As to a few of these recommendations, would this Capitol Police model that was discussed, is that something that would work for corrections?
I understand. John Barman. The Capitol Police model employs several different variables in how it's done. Number one, one of the results of the model is to keep them at a step one, keep them from getting permanent status, and I think that it would probably work in areas where people want a part-time job. What I would put out there is that we have pursued a critical needs designation, critical hire designation for a couple of our locations. We do employ that strategy, and I see that as being similar to be able to access the resources that are out there that are willing to come and work for us. It's been problematic trying to get some of them on board, but nonetheless, we have had several that have been successful and has been quite a relief in our system. I'm concerned about and so in the recommendation for looking at non-traditional employee base, absolutely, we're pursuing it. We want to utilize that. But I also want to be realistic about the expected outcome. If they are required to do 2 weeks of training a year, and we have and then 1 week of training thereafter, and we have and then the range qualifications twice a year, there are a lot of demands to be a correctional officer, and to do that on a part-time basis, it already compromises the benefit of doing that. But if someone is willing to work enough hours to make it worthwhile, absolutely. But if half of the time they're willing to commit is to training so that we can reduce some overtime, you really got to think about the payback. How many hours are we going to require as a minimum in order to justify the investment that it requires, the ongoing investment it requires? There is a payback. There is a benefit for that. And we will pursue that part-time employee base in order to help us out. But it's probably not going to be that beneficial at High Desert, in Las Vegas, or in Carson City, because we have essentially an effective 5% or less vacancy rate. So the places that we would use the overtime would be out at Lovelock, would be out at our conservation camps. Most of the people who work at those institutions don't live in that area. And it's uncertain how far a part-time employee would travel in order to go to those locations on a part-time basis. But nonetheless, it's going to be an offer, it's going to be something that we would pursue. In the case of Ely, we haven't really received feedback saying that they only want to work part-time. We would take anybody, and if they want to work part-time, we would take them part-time. If they want to work full-time, full-time. The nature of the beast out at Ely has been some difficult competition, and I don't know, again, I'm just trying to be realistic, I'm not sure what the payback would be. But our commitment is we would publicize that, we would pursue that actively to see if we could get some type of benefit from it. So we did not turn any of that down. We just want to be realistic about it, but we are interested in pursuing that.
And then last question is, I don't know that I completely understand the volunteer, how that comes about, but why is there a 93% not volunteer? Is that a, you need to ask, like, have a program that gets more people in that system? Or just curious about that.
Thank you, John Barrowman. Again, this goes back to part of my comment. Is a volunteer cheaper than a mandated employee? No, it's still overtime expense. So why would we not want to allow someone to volunteer for whatever personal gain that they want versus mandating someone who does not want to work overtime and say, you must work overtime? It doesn't save money. What it does do is it distributes the overtime over a larger base. Could that help with employee burnout? Could it help with a variety of things? It is possible. But if someone's volunteering, that's generally presumed to be a better condition than mandating someone who does not want to work overtime, mandating them to come in and provide that coverage. And
But a larger volunteer base wouldn't decrease overtime? And I guess that's your
And that's
principal
my
contention.
point.
Do you guys agree with that?
For the record, Warren Lohman. The short answer is no, we do not agree with that. That by expanding the volunteer pool and better scheduling, you're going to be able to schedule correctional officers who may not have met the 40 hours yet during what is now an overtime period or what have you. And it's a more of a holistic approach here where you're looking at who gets the best shifts, who doesn't get the best shifts, which then creates the overtime necessity in terms of the part-time force that we recommended. We really intended for that to be focused on where the overtime, much of the overtime problem is with hospital coverage. So why not put part-timers covering hospitals rather than, I'll say, frontline officers?
Yeah, thank you. And that did lead me to follow up why we wouldn't look for opportunities to hire people locally to cover hospitals or potentially to transport. Are you guys looking at all of those?
so in particular with the part-time, I guess we need to start with the understanding that the riskiest part of our business is when we take an inmate outside of the facility. In the facility, we have infrastructure controls for those inmates. We have safety and protocol, we have backups, we have response teams. We have resources that can provide safety and security very rapidly. But at the point in time that they leave the facility, they become an autonomous satellite which is controlled by 2 officers and could be anywhere from 1 to many more inmates in that van. Taking those to the doctor's office or taking those to a hospital puts us in an environment that is much different, much less controlled than, say, the regional medical facility that we would have in one of our institutions. We're now in the middle of the public, and all of our protocols inside the institution are now challenged if we try to use those out in the public. We cannot use our guns in the middle of a very public area. And so the sophistication and the control, the professionalism, the expertise to handling an inmate outside of our institution is at its highest risk, highest need. And that is not the place to be using a part-time person that is not focused on this as their primary job, as their primary focus. So if we use part-timers, it would not be in a facility that is the highest risk to the state.
And I'll just finish with this, Governor. Going back to the spreading out the base, that seems to make perfect sense to me. I think we're all sensing a very large resistance to that. I would just ask you guys to, out of this meeting, speak to them again and see if there's any way that you guys can have a meeting of the minds, because it does seem to me that if we spread it out, that we would be paying less overtime. So thank you.
Thank you, Mr. Attorney General. Moving to Las Vegas, Madam Secretary or Mr. Lieutenant Governor, do you have any questions?
Yes, thank you, Governor. Mr. Barrowman, thank you for being here, and Mr. Weinberger and your team. I want to just ask a question that was raised on page 3 of the audit report. The audit report notes that the policy of the Department of Corrections is different than federal law labor standards. The Federal Labor Standards Act permits jurisdictions to consider overtime pay based on hours worked rather than hours paid. But under our Nevada Administrative Code, paid leave status is considered as time worked and calculated in overtime. So can't we solve a lot of these problems simply by changing our code to be consistent with the federal law? That is, that our code then would allow us to calculate overtime based on hours worked rather than hours paid. And that's a question for, well, I guess my question to Mr. Barrowman is, would you support such a change in the code?
I believe that this is a statewide decision. It is not something that NDOC could make autonomously. It would have to be consistent for all employment in the state. And if that's the direction that the state went, absolutely we would comply. We would try and maximize the benefit from that.
Yeah, there's a whole procedure to change the administrative code. I understand that, but from just a conceptual standpoint, Department of Corrections would be just fine if the state of Nevada said, why don't we come in conformance with federal law and simply calculate overtime based on hours worked rather than hours paid. You'd be just fine with that?
Absolutely. There's quite a bit of policy discussion behind that. And if that's determined the direction, we would absolutely support that.
Because then that would allow your concern with people taking, incentivizing people to take annual leave. You can still incentivize people to take annual leave. They just wouldn't be given credit for that when it comes to overtime calculation. So it actually would be the best of both worlds for you. You'd be able to incentivize that annual leave, and you wouldn't have to pay overtime if, in fact, they do it within the same time period.
I agree. That would allow them to use annual leave and not necessarily qualify for overtime.
And that would then, to the comptroller's point, address the bulk of what the recommendations call for, and that is to schedule overtime based on hours worked, not on hours paid. The bulk of the $2.5 million audit findings would be embraced by that change in the administrative code. Let me just ask you a couple other questions. Just for my own understanding, in terms of how long does it take for somebody within the Department of Corrections to accrue 6 weeks paid leave?
I am sorry. I do not have that information available. I can get back to you, but.
Okay. I mean, just based on your long experience there at the facilities, would you expect that we're talking, 2 years or more like 10 or 20 years?
Interestingly, we do have geographic differences in the way that they approach their leave. We do use leave more aggressively in the south and more conservatively in the north. So they would probably accrue that 6 weeks within 3 years in the north, and again, very average.
Yeah.
But then in the south, it would be a much longer period in order to do that.
Okay, and then what about sick leave? How long what's the policy in terms of employees accruing sick leave?
They accrue sick leave just as any other employee in the state. In terms of generating a balance, again, in the South, it's used more aggressively, and in the North, it's more conservative. The difference with sick leave, though, is that we don't have a use it or lose it cap. And so they are allowed to accrue as much sick leave as they wish. Whereas with annual leave, we do say you can't exceed the 240 hours. And then that puts an artificial pressure on the employee to make sure that they use annual leave every single year.
Okay, I appreciate that information, and I probably didn't ask the question very clearly, so let me just try again. How long do I have to be employed with the Department of Corrections before I accrue a benefit of 6 weeks paid leave?
If you never use it,
No, I'm talking about the day that I start at Nevada Corrections, am I entitled to 6 weeks paid leave? Is that just a benefit I get day one when I start, or do I have to work there a certain number of years?
all right, thank you. I think I understand now. As with all state employees, you're not allowed to use any annual leave for the first 6 months, but I do believe sick leave that you can use immediately upon accruing that leave.
Okay, and I know this is all statewide, but just for purposes of just focus on the Department of Corrections. So the first day I start working for the Department of Corrections, I can start using sick leave.
Well, God bless bureaucracy. We actually have to have you go through a payroll cycle before it goes on the books before you can use it. So it's a couple weeks down the road, but yes.
Okay, and then after 6 months, I get 6 weeks off, paid leave. Is that how it works?
No.
Tell me how it works.
Yeah.
Tell me how the state employees accrue. What I really want to know is how long do you have to work for state government to get 6 weeks paid leave?
I understand. So you get about 1 day of leave per month. And so if you never use your annual leave, you would get approximately 12 days in a year.
Okay.
And then eventually you would hit that 6-week period.
Okay, I understand.
Let me help here, but he's not asking that. What he is asking is how do you build up your comp time?
Yeah.
6 weeks of comp time, that's 240 hours, and you have a policy within your department that once you've built up that comp time, not vacation time, but comp time, how long does it take you to build up 240 hours of comp time from the day you start?
Thank you for your clarification. I was focusing on annual leave and sick leave. If the question is about compensatory time, we had an issue where we didn't have enough coverage, and so we were allowing the employee to take overtime either as paid or as comp time. And then if they take it as comp time, if they worked an hour, they're credited an hour and a half of comp time. And then at some point in time, they're going to use that comp time. So they're going to take an hour and a half off. Well, if I still need that coverage, now I need an hour and a half of overtime. And so we implemented a policy last year that said that any custody officer where if their leave would generate overtime either for coverage or would generate overtime in order to catch up from the leave, that it would be paid overtime, not comp time. So in the particulars with the custody, they no longer are allowed to claim compensatory time. It is all paid time, because I'd rather pay it at a time and a half once than to give them a time and a half off and now have that exacerbate to time and a half of overtime at time and a half. So in order to stop the cycle, all custody officers must take paid leave. The exception is if they provide overtime services on a holiday, statute requires us to give them the opportunity to decide, do they want to take it as compensatory time or do they want to take it as paid time? So in terms of right now, how long would it take to accrue those hours in comp time? The custody officers do not have the capacity to earn comp time unless it's for holiday services, and that would take quite a few years to ever accrue that much, especially since our use policy is you must use the comp time before you use your annual leave in order to keep those liabilities in check.
Okay, I may circle back around, but thank you for answering my questions.
Did everyone follow that?
Madam Secretary, do you have questions?
Thank you, Governor. I think all of my colleagues on this committee have asked every question, and I think what the only thing I can think of is that I just want to make sure that the department is okay with the 4 recommendations that I see on page 25, and those are the ones that they're going to be working towards. Am I correct?
One, they said no on one.
Just, oh, you're not going to do 1. So 2, 3, and 4 are acceptable?
Yes, thank you. This is John Barrowman. We do have an accept recommendation on recommendation number 2, 3, and 4. And I do apologize if I haven't expressed the urgency of the review that the department is doing. We are actively working on these solutions, and some of them take time to implement, some of them take coordination to implement. And I apologize if I haven't expressed that. But we do understand that it is our responsibility to live within our means and are making every effort to do so.
Thank you very much. I appreciate it. So you're still not convinced that 1 is appropriate? Or you can't do it, let's put it that way.
We still stand by the response to recommendation number 1.
Okay.
That doesn't preclude us from looking at other opportunities, but as recommended, we still stand by that.
Okay. Thank you, Governor. Thank you.
Governor, can I just follow up?
Of course.
Just very quickly, Mr. Barman, why not implement a policy where when you need some overtime, you just look at who has actually taken paid leave during that pay period and just say you're not eligible for overtime, so don't even volunteer for it.
And I believe that, this is John Barrowman, I believe that is the recommendation, is that if they have taken any leave during that pay period, that they would be ineligible to volunteer for overtime.
Right? Wouldn't that just by itself increase this 93% who aren't volunteering?
Yes, and that's our position, is that we do believe that that policy would reduce the amount of eligible volunteers, would increase the number of instances where we mandate officers to provide that coverage, but our concern is that that doesn't inherently save any overtime. That just changes the incumbent that's providing that overtime service.
Okay, I heard your response to all that previously, and thank you for the follow-up answer.
Mr. Controller has a follow-up.
Thank you, Governor, and 2 quick things. One, I want to second what the treasurer said about a fine job by the auditors. Thank you. And 2, Mr. Barrowman, I want to follow up on something that the Attorney General mentioned and you answered in terms of part-time help in Lovelock and 1 or 2 other places, and I certainly understand being familiar with those places, the challenges of getting part-time help out there. But what you said was something to the effect that if somebody indicated an interest, we would look at the number of hours, et cetera. It would seem to me it's easy enough for you to go to each place and do a quick calculation of the threshold number of hours someone would need to offer in order to make that worth your while. And that if you had that information, you could disseminate it and attract people that way. Can you do that, and will you do that?
Thank you, John Barrowman. That is absolutely something we can do, and that is absolutely something we want to do. It is one of the recommendations that we accepted, that we would pursue looking at utilizing this alternative labor pool.
Thank you.
Okay. Any other questions from committee members? Mr. Weinberger, any concluding remarks or comments?
Thank you, Governor. For the record, Steve Weinberger. Just as far as Rec 1, I just want to reiterate what I said, that there are 4 facilities with vacancy rates of 4% or less, and we think there's got to be something we can do as far as changing the scheduling around. And we even say in the report that we understand there will be situations where you just can't prevent scheduling someone for OT who's taken time off in that week, but we do think there's room for improvement.
Just a question, Mr. Weinberger. What I don't want to happen is basically for you to survive this hearing and then go back and study and review and look. I mean, is it unprecedented to have a member within your audit division to be ensconced within the department to ensure that things are happening in a prompt way? Or embedded, however we want to put it.
You know, I'm sorry, can you, I'm not
So
sure I
in
understand
other
the question.
words, whoever did this audit to be basically assigned to sit with Department of Corrections to ensure that something's happening, because we can't, I mean, you are negative cash flow in a big way, and we can't go on like this.
Thank you, Governor. Steve Weinberger for the record. By statute, we have to do a follow-up in 6 months, but beyond that, I mean, I will lend all my resources. I hope Deputy Director Barman knows that. We're here to help in any way we can.
But I don't want to wait 6 months. In fact, you know, I may even call a special meeting a month from now, just to make sure, because this is unprecedented. I mean, at least in my 7 years, and maybe I'd ask you, Mr. Weinberger, if you've ever seen an audit like this where a department is upside down $15 million in 7 months since we closed the budget?
For the record, Steve Weinberger, no, sir. And we can start assisting the department at any time.
I guess I'll say it, I'm not asking. I mean, I hate to be, I'm trying not to be flip, but this is an emergency. This is a fiscal emergency. And it has to be all hands on deck, and I'm not gonna wait 6 months to find out we're $25 million underwater. So I guess what I'm saying is, and you know, I don't supervise your, I guess I kind of do, but you know, I want to feel comfortable so that when I go to bed at night, that I feel like something is happening over there to help right this ship.
Thank you, Governor Steve Weinberger. I think we have our work cut out for us, right? Well, I'll get together with Deputy Director Barman as soon as possible and see what we can do as far as taking some kind of action. The department has had this audit since last October, as you know, so I know they've had some time to think about this.
But again, I'm being redundant, but thinking, looking, reviewing, we're beyond that. Doing, as the controller just said. We need action right away. Mr. Treasurer.
I think what the governor's asking is, can you assign someone from your committee now to supervise what's going on there? A specific person now to be over there.
Thank you, Mr. Treasurer. For the record, Steve Weinberger, I definitely can do that.
Thank you.
Well, I mean, I guess I'll take these one at a time, but when I take a motion on this, that's going to be a part of the motion. At least I would ask the person who makes the motion to do that. So just for the record, you will be able to do that with the resources and people that you have.
For the record, Steve Weinberger, definitely.
As I said, I don't know if it's the worst in history, but it's the worst in my history. And we can't wait. All right, so why don't we do this? Because this one is so unique in terms of the audits that we have, that I will take a separate motion, or these are information items. So we can't take a motion on this.
For the record, Steve Weinberger, that's correct.
Well, I can still tell you to put someone over there, right? I mean, I guess I'd ask the AG.
Yes, I definitely understand, and we'll do that ASAP.
Okay. Mr. Controller.
Thank you, Governor. I think the record makes clear what it is the governor is asking, and I think the record further makes clear the support of, I think, the entire committee for what he's asking.
And Mr. Barman, said you've had better days. I understand. But I have to be sure that we're doing everything we can to try and help you. I mean, that's what this is about, is helping you, not punishing you, but helping you and helping the department to try to find every dollar we can to try to make up for where we are right now. But like I said, within 7 months, we are where we are. So anyway, that's all I have.
Thank you, Governor. You know, I guess I should mention we're currently in the field right now with the Department of Corrections. We're looking at off-site medical. So we're looking at even more ways to hopefully save some money for the department. But I will assign somebody right away on this overtime issue and coordinate with the department and hopefully look for some type of action we can start taking right away.
Thank you. Thank you, gentlemen. All right, let's move to agenda item 4B, Department of Health and Human Services, report number 18-02. All right, please proceed.
Good afternoon, Governor and Committee. For the record, Catherine Brecken. Here to represent the Division of Healthcare Financing and Policy is Administrator Marta Jensen, Surveillance and Utilization Review Manager Candy Wilkin, and Behavioral Health and Pharmacy Chief Dwayne Young. At the request of the committee, we performed an audit on the Division of Healthcare Financing and Policy, or HCFAP. Our audit focused on 2 objectives: ensuring Medicaid fee-for-service behavioral health outpatient treatment clients receive the appropriate level of care, and better assisting providers to understand Medicaid service manual requirements and standardizing documentation to enhance HCFAP's reviews and audits. During our audit, we sampled client files which revealed almost 50% were missing required documentation or required information on the documentation. Due to this lack of documentation, it would be nearly impossible to determine if the clients are receiving the appropriate level of care or if the services provided are included in their mental health plan. We recommend holding providers accountable for not following Medicaid service manual requirements to help ensure clients receive the appropriate level of care. During our sampling process, we reviewed entire client files, including assessments, mental health plans, and service documentation. HCFAP currently uses a data analytics tool to target improper payments, but generally only reviews those specific billings which they believe could be improper. By not reviewing the entire file of clients sampled, HCFAP may be missing up to $7.4 million in improper payments which could be recouped. In addition, by only targeting billings identified by the data analytics tool, HCFAP may not get a broad view as to whether the client is receiving the services necessary to improve or sustain their level of behavioral health as outlined in their mental health plan. We recommend HCFAP perform more in-depth reviews of files to help ensure clients receive the appropriate level of care. Additionally, during our sampling process, providers indicated they are oftentimes confused as to which Medicaid service manual requirements apply to them, and that additional trainings and templates could help them ensure they follow all requirements. We recommend HCFAP increase trainings and templates to better assist providers in understanding the Medicaid service manual requirements. By assisting providers with trainings and templates, it will help ensure client file documentation is complete, which will help to determine if clients are receiving the appropriate level of care. In addition, templates could help standardize client files throughout the state, making HCFAP reviews and audits more efficient. We'd like to thank HCFAP and the providers for their time and input throughout the audit. We'd be happy to take any questions the committee may have.
Thank you very much. Committee members, any questions for audit? Mr. Controller.
Thank you. Just one quick one. Under perform more in-depth reviews of client files, you say that doing so may result in additional recoupments of up to $7.4 million annually. Can you give us a better feel for how much we might expect? Well, what's the distribution from 0 to 7.4?
For the record, Catherine Brecken. That's the amount based on the total amount that they pay out. So it will depend on the number of reviews they can go out and do, and of course, every review is different. But you can expect to find something similar to what's on page 7, where there was about 15% of billings. So you can, depending on how big the sample is, you could guesstimate based off of that.
That's helpful, and I thank you.
Thank you, Ms. Controller. And I do have a follow-up. Sometimes it's good to go second, isn't it? But give me a sense with regard to the audit. Are you concerned? Is this reasonable from what you found, or is it, you know, in terms of degree of concern, where are you with regard to this audit?
For the record, Warren Lohman, working with HCFAP, we would say that what we found is not unreasonable, and that they have a plan and have at least talked with us about the best way forward using their existing processes to get to much of this.
All right, thank you. Mr. Treasurer, do you have a question for the auditors?
Thank you, Governor. This is a more general question, which may or may not be appropriate. What is the contribution of the state versus the federal government to Nevada's Medicaid program?
Thank you. We would refer that question to the
Thank you.
agency.
Marta Jensen for the record. The basic services are around 65% from the federal government, 35% for the state, for the medical services. If you're talking an administrative, it'd be a 50-50.
Right. And what's the total budget for Medicaid, both federal and state? Do you know that offhand?
4.2 billion per year.
It's a big number.
Yes, it is. Kind of makes me nervous.
One last question. Do you expect any changes over the next couple of years in not only the gross amount, but the allocation between state and federal within that budget?
Yes, I would expect, depending on what happens with the CHIP reauthorization or non-reauthorization, there will be a change there. And then every year there is a change in the FMAP. They notify us, I think it's October of every year. And so it can go up or it can go down.
And what is that based on?
I would have to defer that to my CFO.
Okay. Right, okay, good, thank you.
She's present if you'd.
But yeah, I'd be interested. As I say, it's not strictly germane. But.
Ellen Crecilius for the record. The normal federal, or FMAP, the Federal Medical Assistance Percentage, is based on a 3-year lagged average of Nevada's personal income per capita compared to the rest of the country. So if we tend to have a higher personal income per capita than the rest of the country, we have a lower FMAP rate.
Good, thank you. I don't want to stray too far from the thrust of the committee here, but thank you, it's helpful.
So in other words, our FMAP rate is less because our economy is doing better.
Better, okay, good. Good.
All right. Ms. Jensen, your response to the audit, please.
So first I'd like to say thank you to the audit committee. They were exceptionally professional and diligent in their efforts, and I really appreciate that. I use this as a free gap analysis on where we can make improvements. To give you a little history on our Surveillance and Utilization Review Unit. So right now, on the Medicaid program, we have approximately 28,000 providers. We process over 1 million claims per month, and we have about 650,000 recipients that are on the Medicaid program. Of that, around 478,000 are on the managed care. So their review, I believe, entailed the fee-for-service population, which is around 175,000, so 176. Of that, the Surveillance and Utilization Review Unit, they're required through the federal government as an overseer of our claims and our processes to ensure program integrity. Currently, our state has 17 individuals that are within our surveillance, our SEER unit. And of those 17, 14 are actually the reviewers of the individual cases. How they review cases, it depends on the area. We try to spread across our entire provider base. We find that one, we're not allowed to focus on one provider type through the regulations. We're discouraged from doing that. But when we also try to spread it across the full provider base, it has more impact in the sense of making sure that people are educated on the processes, they know what the rules and regulations are. Once you educate them, any negative action on their part, you can then look at it to see if it's more of an intentional fraud versus just a waste or abuse. So of the providers that we're looking at or that they looked at in their review, we have 5,000 individual mental health providers in the state. How they get the reviews for SIR is typically it's a referral. So somebody either files an anonymous complaint, they can call it in, email it, and then we also have data software that does data mining, where it's looking for issues in the claims database to say that seems unusual. That many services can't be provided in a 24-hour day when you're claiming 30 hours and so forth. So we do have certain activities in effect that identify where we need to put our time. The difficulty that we have is 14 reviewers for this many providers. We do try to put a higher emphasis on the providers that we consider high risk. High risk typically is our behavioral health and mental health, sometimes our home health services or personal care services, your durable medical equipment providers. That tends to be the group, so we try to maintain a presence in that marketplace. The other areas, like I said, depending on how the tips come in, we shift our focus and try to address that issue if we can, to get them noticed that you're doing this wrong. If we have to tell you twice, it is intentional, and then we pursue a different route through our Medicaid Fraud Control Unit. We did agree with all of the recommendations that they put forward. We do have a couple of concerns on 1 and 2. We agree that looking at the level of care to make sure that the recipient has the appropriate level of care identified so they can receive the services that they need. The challenge that I have is I don't have clinical staff within the surveillance unit. I have one individual who is a nurse, but this isn't her specialty area. So she's not qualified at this point to do that clinical review. And then I think on the second recommendation is where we talked about doing a more in-depth review. And we would love to do that, but what happens from a provider perspective, depending on how far back you want to go? You don't want to create so much harm that you end up charging this huge overpayment. They thought they were doing it right. You charge a huge overpayment, they may go out of business. I need them to provide services for our recipients. So sometimes you educate, you do take some money back, and then you watch going forward to make sure that it doesn't happen again. With 14 staff, it does make it hard to cross that gamut. But I think an in-depth review is a good idea. But what happens is if you do that on a particular provider type or a provider case, it will take the time away from another group that we're also trying to watch. So it just kind of depends on where you want to put the efforts. I think the SIR team has done an incredible job to date in state fiscal year 18. They've already collected $8.3 million in overpayments. That has steadily increased. I think it was 2.5 in 16. I think it went to 5.4 in 17. We're currently halfway through the year and we're already at 8. So their efforts are working. We're finding what we can. Can we do more? Absolutely, but I'll need some resources for that. So we thought that we would analyze what would that look like. Can we shift responsibilities? What's the risk on that? Can we ask for additional staff in the next session? What do we need to do? Now, we did receive an additional 4 staff members for this unit in the last session in 17. However, those positions were identified to handle the providers that are billing through the Aging and Disability Services Agency. So they're not really captured in my group because they're identified to work a specific provider type, or I should say a provider base. On items 3 and 4, we again agree with the recommendations that we could do more in the training, and we could also put some templates together. We don't want to make it mandatory because some of our providers already have systems and they're well versed in the marketplace. So we would want to put a template together that we can offer to help them. We do take seriously that they don't have all of the documentation within the file, but if a piece of paper is missing, it doesn't prove that they didn't provide the service. And we have found challenges when we've tried to attempt a recoupment, and we go forward with a hearing, and we have lost in a hearing because they're saying, but prove to me they didn't provide a service to one of your recipients. So what we tried to do is shift our process to make sure that, okay, we've educated, we may take an overpayment, we may not, but we definitely educate them on what the requirement is going forward, and then we'll do a look back after we've made that education to make sure they're following the rules going forward. Because really, we want compliance, but I also need these providers to see my recipients. So as for the training, we did indicate that we would add an additional training in the afternoons, but we were sending out a survey to our providers, the mental health, behavioral health providers, and unfortunately we got a dismal response, less than a 1% response. We have 5,000 providers, and it was less than 100. And so we didn't want to create a training program just to check the box, we got one. Really what we want to do is now reach out to the people that didn't respond and find out, okay, what are your needs? What kind of training are you interested in? Is there a better date or time? Currently we provide a webinar every month, the second Wednesday of the month, and we have, I think the most that we've ever had attend is 12%. So we have to do things differently, and we're open to that. We just have to explore what is that, what will get the information to them so we can lessen the discrepancies within the case records and the services going forward. So the survey was sent, as indicated. We received those in the responses back in October. We've taken a look, and now we've figured out we need to do something different. And we're trying to figure out how do we get to the providers that didn't respond. And then again, on recommendation 4, we agree that we can provide the templates. We'll start working on that this month, trying to put that together and then align it with one of those trainings to say, here's a template that's available for your use, not mandatory, because again, we have providers that already have their system working and we don't want to disrupt them. But we do agree with that recommendation as well.
Questions from committee members, Mr. Controller?
Thank you, Governor. At page 9 of 18, and I guess this is more for the agency, but I'll be happy to hear from the auditors as well if they have anything to say. The objective is to better assist providers to understand Medicaid service manual requirements and standardized documentation to enhance HCFP reviews and auditing of client files. My question is, we're talking about helping providers to understand what the Medicaid service manual requirements are, et cetera. That would seem to me to be very basic, that they should understand without a lot of help what the requirements are. But there's been such a metastasis of documentation and procedural requirements, especially with Medicaid. Is that the point here, that they don't understand that because they're trying to catch up to the federal, the burgeoning federal requirements, or why do we have to help them understand what they ought to be doing?
So, Marta Jensen, from the Medicaid Service Manual, there would be the 2 chapters. There's the 100 chapter, which details what you need to do to become a provider on Medicaid. Chapter 400 is the chapter that they should be familiar with. What we are finding is there is an incredible growth where somebody may have started in a company as a therapist or somebody that was performing the service, and then they find out, I think I can do this better, I can do it differently. They'll open up their own company, but they don't always understand all of the rules. So I think there is part of that education. But I think Dwayne Young is the chief of our behavioral health and pharmacy unit, so I will also defer to him to give you some more in-depth information.
For the record, Dwayne Young. Additionally, with providers, Medicaid kind of walks a fine line, is that we cannot tell providers how to document. We cannot tell them how to write their prior authorizations as a payer. What we have realized as part of the division of as part of the overall Department of Health and Human Services, we do have an obligation for these providers. And so part of the recommendations that we respond is that we have to link with our sister agencies, the Division of Public and Behavioral Health, and then do better training throughout DCFS and ADSD, Aging and Disability Services as well, to have them help us engage their providers and help them to understand. I think while the policy is very straightforward, a lot of providers do not necessarily understand how is the best assessment tool, how do I document that assessment tool, how do I document those notes, how do I do prior authorizations. One thing that my unit has 4 people in the behavioral health side. We do take the time to meet with providers that request it, but with the understanding that we cannot do that for all 5,000 providers, because every hour that we take to meet with the provider to go over their prior authorizations is every hour that's taken away from another project. So we do recognize that we have to continually engage them, but part of that is reaching out to our community partners and our sister agencies as well.
So it would be fair to say, I think, that the proliferation of federal regs and mandates and details and so forth here is certainly something that's an continually increasing burden to the providers, but it's also, while not an unfunded mandate to the state, it becomes effectively the same thing by being a burden to us to help them know what they need to do and to help them comply.
Yes, I would agree with that.
Thank you.
Just a short follow-up, but I don't know, Mr. Young or Ms. Jensen, but if there's an obvious fraud within the billing, I mean, I get that someone's not trained and it's complex, but you always have the discretion to refer the matter to the Attorney General's office in the Medicaid fraud unit, correct?
Absolutely, and we do so. We have a good relationship with them whenever we believe that it is fraud, and sometimes it's so blatantly obvious, those go immediately to them. Sometimes they can accept them, sometimes they can't, depending on what their workload is. But they have also, it's my understanding, been instructed that they also cannot focus in on one provider area. They have to cross multiple provider types.
And then, just a hint, when you're doing your budget requests, you might want to throw in a couple more people.
Yes.
If we can show that we can recoup, a couple more people can recoup millions of dollars, I
We
think
can
the
absolutely show
cost-benefit
that.
analysis works there.
I'm on it.
Okay, thank you. Mr. Treasurer.
Thank you, Governor. I just want to make sure I'm understanding the macro math. You said that the entire Medicaid budget was about $4.2 billion. Is that correct?
Yes.
And you said 35% of that was paid by the state. Is that
Yes.
plus? So just doing the math, that's about 1.5 billion. Is that
1.5 million?
a billion?
Billion, okay, that's better.
Right. Okay. And again, just so I understand, we're talking about $7 million in overpayments here, possibly. And then this to the governor. So, and we have about $2 billion in state funding for education. Is that sort of back at the envelope?
I'm not running for governor, Mr. Treasurer. So, I want to know that.
You may have a, so I guess my point is, so I'm trying to understand the macro position here is that you've got roughly about 3.5 billion in between education and Medicaid, which leaves about another 500 million for everything else. And then out of that, I see Mr. Wells in the back there, maybe he can confirm that. So this is obviously a very important part of our budget.
Yes.
And we're talking about $7 million trying to recoup just through overpayments. Is that correct? Just my math, back of the envelope math.
For the record, Steve Weinberg, that is correct. And I think...
and I'm not diminishing that. I think
okay.
at all.
That is correct. And,
yeah,
and basically, you know, the thought is compare that to how much it would cost to get some more served people out there and put us in a plus situation.
Okay, good. Thank you. Thank you.
Attorney General.
Just quick follow on to the governor. Does each body pay for itself at this stage of the game?
Absolutely.
We're doing 20 new bodies. Are we now into the tens of millions of dollars recovered, very likely?
Depending on the depth of the review, yes. They pay for themselves and then some.
Questions from Southern Nevada, Mr. Lieutenant Governor, Madam Secretary.
Thank you, Governor. Ms. Johnson, thank you very much for being here today. I think you all do extraordinary work for the workload. 28,000 providers, 1 million cases a month, 650,000 people on Medicaid. It's just mind-boggling what you have to do. And you got 14 people to try to kind of oversee whether or not the providers are doing everything we're asking them to do. And I know it's a Herculean effort. It really is when you put that in perspective. But let me just ask you just kind of a fundamental question in terms of just kind of your feel for how we're doing. One of the very first objective of the audit was to ensure that Medicaid fee-for-service behavioral health outpatient treatment clients receive the appropriate level of care. And then when you read in the audit this sentence, consequently, there is not enough information to determine if clients are receiving the appropriate level of care. The entire audit's purpose was defeated because people aren't keeping records. What's just your sense in terms of just what's going on? Are you feeling like, and has your experience been that those Medicaid recipients of behavioral health care outpatient treatments are getting the care they need?
That's a difficult question to answer. I think some of them are. I think some of them are not. In some cases where there's absolutely no documentation, obviously we would collect on those. But when there's a piece of paper missing or 2 or 3 out of the whole thing and we can see services were provided, in that case, like I said, we have reimbursed and we have not charged an overpayment in some of the cases. If it's a provider that we call frequent flyers, they seem to show up on our list all the time. We watch them very closely and they don't get as much leeway. But I would say that yes, some people are getting the services that they need. They're doing better. They're making progress. But I do believe there are providers that are not providing the service and the recipients may or may not be getting any service. They're billing just because they have a Medicaid ID. And that's really what we're trying to get to the bottom of, to root out. We're not interested in doing business with anybody that wishes to fraud the state, but I have to be very careful and walk that fine line that I have providers to provide the service. And if they've made an administrative error, we need to educate and fix it because I need that partnership. But if they're intent on frauding us, I have no interest in doing business with them, and I will do everything I can to get rid of them.
And you may not know this just off the top of your head, but approximately how many providers of behavioral health care outpatient treatment do we have in the state?
Currently, we have around 5,198 as of August of 2017.
Okay, and was that 5,000 the one that you had indicated earlier that when you put out a training call that about 100 of them participated and that was it?
Yes.
Okay. And then you just talked about in terms about how you're going to try to improve that and what you're going to do. So it's not really a situation where we don't have enough providers. We got 5,000 providers. So if they're not doing their job, if they're not keeping the documentation, the state should have no problem cutting them loose. You talk about walking the fine line. With that many providers, why do you have to walk a fine line?
Oh, I'm sorry. Go ahead.
No, please go ahead.
Not all of the providers provide the same service. So
Right,
some of them can do a more in-depth, it can be a facility, some of them are individuals. It just kind of depends on what that provider mix is. When we pulled the numbers, that's where we got the whole group, facilities plus individuals.
Okay. And I noted that in the audit, I mean, there are situations where, for example, Mr. Weinberger, your report says that 2% of the billings were for a different service code than documentation, and that could represent to $600,000 of improper payments. Those could be improper; they just could be the wrong documentation. It's just a matter of coding. In the world of in medicine and with all the different Medicaid code requirements, did you come across actual instances where you saw that the services that were being provided were in fact, based on the documentation, fraudulently documented, or was this just your sense of this is just a discrepancy in terms of just plugging in the wrong code and it was more innocent than it was fraudulent?
For the record, Catherine Brecken, no, there weren't any instances that we would say were fraud, but there were times where, yeah, it could have been an administrative error where they put the wrong service code and were paid for a different code, or it was a 30-minute session and they got paid for 60 minutes, or, you know, that's one digit wrong on the code.
Right, right.
So no, I wouldn't consider it fraud.
And did you find any instances or have any inkling of any instances, but, you know, in the case of, as Ms. Jensen saying, that there's somebody out there that's billing Medicaid and they don't have documentation because they're not providing services? I mean, you see anything that egregious?
We had, for the record, Catherine Brecken, we had times where there was no documentation for services that were paid, but we did not give the providers a chance to get that documentation if it were not in the file.
Right, you were just auditing the file itself. Okay.
Correct.
Thank you, Governor.
Thank you, Mr. Lieutenant Governor. Madam Secretary?
Thank you, Governor. I think you've all asked every question that there is to ask. Being the last,
I'll start with you first on the next.
No, it's okay. I just wanted to make sure, I hadn't heard if the agency has accepted the recommendations. That's why I just wanted to make sure that I heard that correctly.
Marta Jensen, for the record, yes, we've accepted all 4 recommendations.
Okay, and have you started on any of those recommendations yet, or is it something that you're making plans for?
No, so recommendation 1 and 2, we have to look at our staffing analysis and we would be requesting additional positions in the upcoming budget. Recommendation 3 is for, I believe that's the additional training.
Yes.
That's where we did the survey, and because we didn't get a really good result, I didn't want to just implement a training just to check the box to say, there, it's offered, if I didn't think anyone was going to attend or it wasn't worthwhile. So we're retooling that to see if we can get a different level of participation from the providers. And then on recommendation 4, that's for the templates.
Yes.
And that one, we're starting that this month.
Okay, and thank you for stating that. I know that you've discussed this before. My other question to you is, how many vacancies do you have? Do you know what that number is?
In the SIR unit?
Yes, the one that's helping with the Medicaid, the filings, the looking at reimbursement, those types of things.
So in the SIR unit, we're fully staffed.
Okay.
And then of the additional 4 positions, I think we've offered on 1, which is the supervisor position. Unfortunately, they turned us down, and so we're going through the recruitment process again. So I don't believe we've hired any of the 4 yet. But those are designated specifically for the Aging and Disability Services Division, based upon an audit that our friends at the Audit Commission did for them.
Okay. Thank you. Thanks, Governor.
I didn't detect any sarcasm in that response.
I was happy for the additional positions.
All right. Just to follow up on the Lieutenant Governor's question, so if you've identified a provider out of these 5,000 that routinely overbills, is there a jeopardy in terms of continuing services for that treatment provider? In other words, do you say, do you tell them, hey, there's a problem here, but if they continue to do that, do you remove them as a provider?
Yes, we would send a termination letter. Depending, in some cases, like I said, depending on what the issue is, we will refer it to the Medicaid Fraud Control Unit, and then they could take it from a criminal perspective.
But even then, not if it doesn't rise.
We still terminate.
Okay, that's all I need to know. Thank you. All right, committee members, any further questions for Ms. Jensen? Audit, any concluding remarks, Ms. Brecken? Okay, well done. Thank you very much.
Thank you.
We'll move to our next agenda item, which is 4C, the Department of Health and Human Services Report Number 18-03, Health and Human Services State Trust Funds.
Governor and members of the committee, for the record, Vito Zuda, at the request of the committee, we audited the state trust fund managed by the Division of Welfare and Supportive Services State Collections and Disbursements Unit, SCADU, and the Division of Public and Behavioral Health, Northern Nevada Adult Mental Health Facility Services, NAMS. Representing Welfare and Supportive Services are Nova Murray, Deputy Administrator, and Brenda Berry, Administrative Services Officer. And representing Public and Behavioral Health, Amy Rookie. Is Amy here? Okay. Yeah, Amy Rookie, Administrator, and Ed Blazer. Okay. We conclude based on our audit, both SCADU and NAMS can strengthen controls over funds received. Additionally, NAMS can strengthen controls over disbursements to clients. SCADU can strengthen controls over funds received by involving more than one staff member in the opening of mails containing child support payments, opening all mail in the count room, and depositing funds accumulated to $10,000 or more by the next business day per statutes. The Division of Welfare and Supportive Services can help strengthen controls over funds received by recording bank deposits and disbursements timely in the state's accounting system, Advantage. While recording deposits and disbursements timely in Advantage has no effect on issuing child support payments, it provides timely bank reconciliations, which can help detect questionable bank charges in a timely manner. Strengthening controls over funds received will ensure child support payments are adequately safeguarded and available for distribution, ensure compliance with statutes, and provide timelier bank reconciliations. NAM's patient account can strengthen controls over funds received by reconciling logs of incoming checks to deposits and ensuring accumulated funds of $10,000 or more are deposited within the next business day in compliance with statutes. Additionally, NAMS can strengthen controls over disbursements by restricting access to unused checks and the financial software, namely QuickBooks and Positive Pay. Strengthened controls over disbursements will ensure client funds are sufficiently safeguarded. If controls over financial software cannot be strengthened, NAMS should evaluate using the state's Advantage accounting system to manage trust funds in order to provide adequate safeguards for client funds. We would like to thank the department for their cooperation and assistance during the audit. This concludes my presentation.
Thank you. Please proceed.
Good afternoon, Governor Sandoval, members of the committee. My name is Nova Murray. I'm the Deputy Administrator in the Division of Welfare and Supportive Services. We actually have two separate agencies here at the table. Three of the findings belong to the Division of Welfare. We accepted the findings at the exit interview, and we made all accommodations and procedures are in place immediately to fix the problems. And we were also afforded, through this last legislative session, an automated process that will fix some of these, even to a better end. It's an automated opener, scanner, indexer, batcher, and deposit. So most of our things will be able to be done immediately in the bank, and it solves the problems on the division side for welfare.
No, thank you, and that's my impression, at least, is that everything is done.
Yep.
Yeah, that's
Thank
good.
you.
Good afternoon, Amy Rookie for the record. Thank you, committee members, and thank you to Vita and the Executive Audit Committee for the information related to our audit of our client trust fund accounts at NAMS. We have implemented all of the appropriate responses provided in these recommendations, with the exception of recommendation number 4. We have been evaluating the use of Advantage rather than our current system. We have increased our internal controls so that we are more responsive. However, at this point in time, the use of Advantage would require changes in our electronic payment system coming from the Social Security Administration, a process that would take approximately a year, and would create quite a bit of confusion for both our agency and for the Office of the Controller accepting these payments. We act as representative payee for these clients, so we accept their funds and then manage their basic needs through this process. So we're paying for food, clothing, shelter, and assuring that their personal needs are cared for. With these increased controls, we believe that we can comply with the request of this audit. Thank you.
Thank you. Committee members, any questions? Oh, Madam Secretary.
Thank you, Governor. And while I'm happy to hear that they're in compliance and have brought this up, I just asked a couple questions on your procedure of taking money in. Is the money deposited in a safe on a regular basis or just once a day?
Nova Murray, for the record, the money goes into the safe as it's processed. It goes in all day long, so as it batches, it goes into the safe, and we have an armored car that picks it up.
Okay, that was my other question. Thank you. And then what about bad checks? Are you able to scan those checks so you don't receive, or you know whether or not they have the funds in the account immediately?
We currently do not have that ability. The OPEX machine that we currently are in the process of bringing on through the joinder recently signed, January 31st, that machine does have those additional abilities. Depending on how far we go with this particular provider, they have the ability to get us to that point where we will know if the money is in the account. We generally don't take personal checks. We take business checks. We take cashier's
Debit cards?
checks.
I'm sorry, do you do debit cards as well?
We do not. We currently take credit cards over the phone. We do not take debit cards. I don't know that we would know the difference, but we are not seeing a high volume of returned checks. This audit is just specific to making sure that we are touching the money appropriately and have enough eyes on it as it comes in. We don't have a high volume of return checks.
What was the issue? The biggest problem was the armored car coming to get the checks or the cash?
The biggest problem, Nova Murray for the record, sorry. The biggest problem we have is that the influx of our money is due on one day. So through the month, we have plenty of staff to take the daily volume, and then all of a sudden at the end of the month, when everything is due, we get swamped with thousands and thousands of boxes of checks that have to be processed, and you have to get them to a certain point before you send them to the bank. We actually take copies, we scan them into the system. All of that audit record has to be put in there before the check goes to the bank. This system that we will have in place on January 31st will resolve that same day.
Great, okay. Thank you very much, really appreciate it. Thank you, Governor.
Thank you. Mr. Lieutenant Governor, any questions?
Governor, I'm satisfied with the department's response to all these recommendations, so thank you.
Mr. Controller.
Thank you, Governor. And I too am gratified on that. I did want to take this opportunity, since you all did such a good job, to state what at least one member of this committee believes the format for response letters from the agencies and departments should be. And this is from my time as the Audit Committee Chairman twice for the fourth branch of government. What I said was, I'd like to see a clear statement such as yours about whether you agree in its entirety with the audit findings and recommendations, and if not, specifically which ones you disagree with and why. Secondly, exactly what you're going to do about it. It's easy when you've already done it. And third, who's going to do what and who's going to be held accountable for doing what? And fourth, what time frame it'll be done, et cetera. Any other comments are helpful, but I would hope that the agencies would provide that kind of particular, detailed and on-point response in every case. And I just take the opportunity to put on the record what I expect. There are other people on this committee, but I think that's good practice. Finally, to Mr. Azude, I'll just ask you, is my favorite sprinter, the Pride of Nevada, doing well?
She's doing fine. Thank you.
She's great.
Yeah.
Thank you. Mr. Treasurer.
Thank you, Governor. This is a question for the Deputy Attorney General, and since we're graced by the presence of the man himself, perhaps the Attorney General, we seem to be dealing with potential complaints here, and I guess both under C and B, in other words, Medicare fraud complaints. Have you been asked to investigate any sort of types of complaints or frauds or checks that haven't been deposited?
I'll take that question since this is not her particular department. As stated, our Medicaid fraud unit works regularly alongside this agency, and we have a large volume of successes and prosecutions.
Good. So you have indeed received complaints and you are prosecuting them?
Absolutely.
Good. Thank you.
Any further questions with regard to this audit? Thank you. Very well done. We'll move on to the next agenda item, which is Department of Veteran Services Report number 18-04. Please proceed.
Governor and members of the committee, for the record, Vito Zude. At the request of the committee, we audited trust funds managed by the Department of Veteran Services. Representing the department are Catherine Miller, Director, and Amy Galland, Executive Officer. Based on our audit, we conclude the department should segregate the duties of receiving and recording funds at the veteran's home and also restrict access to the checkbook. We noted the staff member who receives funds also records the funds in each resident's account in the ADL accounting system. In addition, 2 employees who perform the recording function in the ADL system also have access to the checkbook. Segregating trust fund receipts and recording functions, as well as restricting access to the checkbook, will ensure trust funds are adequately safeguarded and available to residents. We would like to thank the department for their cooperation and assistance during the audit. This concludes my presentation.
Morning, Director Miller.
Good morning, sir, members of the committee. For the record, Kat Miller, Director of Veteran Services. First, I'd like to say thank you to Mr. Azude. This audit, like all the others, we've immediately implemented the recommendations and found it made our processes stronger and made me personally feel like we were better protected. And as I said, immediately after the outbreak, we implemented the recommendations that were made with one minor detail, and that was moving the safe. And we're in the process of doing that, but that requires some physical changes around the facility and move them, and we'll have that done by the end of April. That's all I had, committee members. If there are any questions?
Thank you, Director Miller. Any questions from committee members? Your work is done. Thank you. Thank you. Move on to the next agenda item, which is the Department of Motor Vehicles Report number C18-01 System Modernization Project. Director Albertson, good afternoon. But start with audit, please. Yeah.
Thank you. Good afternoon, Governor and members of the committee. For the record, my name's Jana Lynn Seeley. Here representing the Department of Motor Vehicles is Director Terry Albertson, SysMod Manager Izzy Hernandez, and Tech Mahendra's Project Manager Aman Sethi. At the request of DMV, we performed an audit of the System Modernization or SysMod project contract. In our audit, we focused on one objective: how DMV could help ensure information technology projects performed by contractors progress timely. During the audit, DMV represented that the SysMod project was not progressing as expected, due in part to the contractor not fulfilling representations made in its RFP response. Specifically, the contractor did not provide a cohesive project delivery team with the level of expertise in motor vehicle system modernization, nor did the contractor provide team members proficient in written English. However, DMV did not ensure compliance with established contract requirements, protocols, and procedures, such as the requirement to amend the contract with an approved master project plan, protocols for the deliverable submission and review process, procedures for the resolution of issues, and miscellaneous requirements related to the use of the state resume form by contractor and subcontractor personnel and identification of subcontractors. Adherence to these contract requirements, procedures, and protocols may have mitigated delays to the SysMod project by enforcing project deadlines and holding the contractor responsible for performance shortfalls. As a result of the audit, we made one recommendation: to improve the effectiveness of project management. Improving the effectiveness of its project management and ensuring compliance with the established contract requirements, protocols, and procedures will help DMV to ensure information technology projects performed by contractors progress timely and are completed as authorized. At this time, we'd like to thank the DMV for its help throughout the audit, the SysMod staff, purchasing division, and Tech Mahindra. We're happy to answer any questions you may have. Thank you.
Thank you. Any questions for audit from committee members? We'll move to you, Director Outram. Mr. Treasurer.
Thank you. A quick question. So just if I'm hearing you correctly, that it seems to me that there's work to be done in ensuring that this contract is carried out the way it should be carried out.
For the record, Jana Lynn Seeley. Yes, sir.
Thank you.
Director Albertson.
Yes, thank you, Governor and members of the committee. And again, I want to give my heartfelt thanks to Steve and Jana and Mark for the hard work that they did in delving into this project. Obviously, it is a high-profile, high-risk information technology project. So again, it was done at our request that they come in and complete this audit in order to allow the department and the vendor to reset and evaluate where we were at that point in time. So the audit was completed actually in August of last year. As a result of that, the department submitted and agreed to the recommendations. We have 8 corrective action items that we submitted in response to the audit. I am happy to report that as of today, and as we indicated in our September 14th response, that we would have had these items completed by December 31st. We have successfully done so. So the project plan has been amended. We have hired an administrative assistant to provide support services to the program manager to allow him to more effectively manage the project on a wide scale. We have updated and implemented the deliverable sign-off process to ensure compliance with the RFP. We are continuing to use the issue resolution process log in order for both the Tech Mahindra vendor as well as the SysMod team to record and respond to the issues as they come up during the project. We've also updated the Tech Mahindra onboarding process to ensure compliance with the RFP and that they would utilize the state resume form in onboarding their resources. And again, probably the biggest point of this is that we did amend the contract to include the detailed project plan to ensure compliance with the RFP, and that was approved by the clerk of the board on December 19th, 2017. We have changed the decision escalation process by providing project management tools to the DMV division administrators to expedite the resolution process. We have changed the existing project management tools to provide additional metrics and dashboards for the project management office to better track deliverable and milestone dates. And lastly, we have initiated the process with state purchasing to hire the independent verification consultants to provide a project assessment with best practices. So as a result of that, we did hire the Gartner Group who are in the process of completing that study as we speak today. We anticipate that we will have their recommendations no later than January 29th. So with that, be happy to answer any questions the committee might have.
Thank you, Director Albertson. And will you refresh my memory? How much is this contract?
It's $115 million.
Yeah, no, I knew that. So
It's a big one.
It's a big one. And so it begs the question, is Tech Mahindra, is the vendor in compliance as we speak with the terms of the contract?
For the record, Terry Albertson, I would say there are still issues that need to be worked on with the vendor, Governor. I want to be honest in my response to that. Again, Tech Mahindra has committed to the department that they will provide us with the resources that are necessary to ensure the success of this project. Mr. Sethi is here today with me. If you'd like to answer some more specific questions, or perhaps if he has some additional insight that he'd like to provide to the committee, I would welcome him to join me.
And I don't know if we're within open meeting law to be able to ask those questions on the record, but this is one that I've been bird dogging as well, and it concerns me very much because of the lack of performance by the vendor on this contract. And kind of similar to our first agenda item, I hope there's a sense of urgency because at some point we get to a place where we have to move on, if depending on the contents of that contract. But there's a lot at stake here with regard to DMV, because obviously the DMV touches every person in our state practically. We had that conversation last week with regard to that other event. And, you know, just looking through this, these are, as you said, the issues, the audit was done last August. So there's been a significant period of time within which the vendor has had the opportunity to catch up. And so I guess that's what my question is do you see progress on the part of the vendor that they're coming into compliance? Because obviously they were not.
Thank you, Governor. Terry Albertson, for the record, I would say yes. As we sit here today, I believe that the vendor has demonstrated their desire to improve the effectiveness of the delivery of this system modernization effort, but there continue to be issues.
Yeah, and it's kind of similar to what I was saying that corrections desire is a, you know, I desire a lot of things, but that's different than performing. And so, you know, I guess that's what I'm asking here is lots of letters and nice emails saying we're going to do this, this, and this. That sounds nice and maybe buys a little bit more time, but is there actually action coming on here where they're coming into compliance with the performance of this contract?
Yes, thank you.
Governor, may I interrupt briefly? I mean, given the scope of the contract, I think it'd probably be better that we just evaluate this offline before we necessarily lock ourselves into any position as a state on how they're performing or not
Well,
performing.
I think she can talk generally about this because it's important, because it's germane to the audit. And obviously, I don't want to see it to get into a litigation mode and then them to say, oh, Director Albertson said on the record at the audit committee meeting that we said we were doing okay when we really weren't. But they obviously have not been in compliance, or it has obviously not been in compliance with the requirements of the contract. And I just want to see if there is an earnestness or a sense of urgency, as the words I used before, to come into compliance.
Thank you, Governor. Terry Albertson, for the record. There certainly is on behalf of the department. And again, I think that the report we're going to receive from the Gartner assessment by January 29th is going to provide further details for us to make that final determination.
Okay, thank you. All right, Mr. Controller.
Thank you, Governor. Director Albertson, I want to start by saying I feel your pain because the Controller's Office the last couple of years went through a similar problem and through similar machinations, and we had to fight to make sure that the terms of the contract were fully honored by the vendor. It was much smaller than this, but it was a lot to us, and it meant a lot. I certainly understand the problem here and the challenge, and keep on it. It took us a long time. It may take you a long time, but that may help you get there. With that said, I'll just add that at pages 9 and 10 in your letter, you give the kind of detailed response with items 1 through 8 that I was talking about a moment ago that I want to see. What you didn't do was say exactly who within DMV is responsible. I suppose on something this large, you're ultimately responsible and everything gets bucked up to you anyway. But if you don't put the burden on somebody in particular by position or name, it will accrue to you always in the future. Good job, keep it up, and thank you.
Thank you.
Good job by the auditors, too.
Mr. Treasurer.
Thank you, Governor. Let me just ask the auditors, are you satisfied with the answers you have gotten from Director Albertson?
Thank you, Mr. Treasurer. For the record, Steve Weinberger. In general, yes, definitely. It looks like some of these specific measures they've mentioned are along the lines of what we were expecting.
How about in specifics?
Well, a lot of that is to be seen. We'll see how it goes with the remainder of the contract. But what we obviously we weren't auditing the vendor, we were auditing the state agency, and I think they got the message of what we were looking for.
I assume that this Gartner report on the 29th will be an important step in evaluating the contract? Okay.
Yes, thank you. Terry Albertson for the record. So the audit committee is not involved in that part of this particular assessment. So the Gartner Group is reporting directly to me as the director on their independent verification and validation of not only the DMV process, but as well as the vendor. And so they will come forth with what they've identified as issues with the project, if there are any, and also a recommended plan of action. So that finalized report is a critical piece to this particular modernization effort. And like I said, we expect that by the end of January.
I think it maybe per the governor's suggestion of holding a meeting next month, is that might be something you put on the agenda for any sort of special meeting of EBEC.
Thank you, Mr. Treasurer. Terry Albertson for the record. We would welcome the opportunity to come back to the committee next month with an update on the status of that health assessment.
Thank you. Up to the governor.
Yes. Any other questions from committee members from Southern Nevada? Mr. Lieutenant Governor.
Thank you, Governor. I just wanted to ask a couple of follow-up questions here. The audit says that as of July 2017, DMV's expended $13.5 million on the SysMod project. How much currently has DMV spent?
Thank you for the question, Mr. Lieutenant Governor. At this point, we're approximately $27 million in.
So we're $27 million into a $115 million contract, I think 5 year, right?
I'm sorry.
So I'll just make this observation, and I'm not putting words in the governor's mouth, but just as a follow-up to what he said, it's much better to get out sooner than later. It's much better to get out sooner than later. If they're not performing, then somebody needs to make that decision quickly, get out, cut your losses, have the Attorney General do what he's going to do on a legal standpoint and front and find someone who can. I mean, this to me, you know, if you read this, I read this as a lawyer, and I say this is a big bait and switch that occurred, right? You put everything into the RFP that you think the state wants, you make all the promises, and we accept all those promises, and then they just don't deliver. They say they're going to give us, you know, what? They're going to give us 25 A-team members. They proposed. They've given us 6 a year into the project. 3 of them didn't start until April of 2017. A 4th was removed after 2 months. A 5th was then removed and returned to project several times. A 6th assumed duties and assumed multiple responsibilities. They were supposed to be providing us proficient communication. It was so bad that we had to edit their documentation for grammar and spelling. They promised us that people would be proficient in communicating and speaking and reading English. It wasn't written in those kind of clear manners to the point that we had a basic grammar and spelling. I mean, is that too much to ask for? To me, that's a very, very huge red flag. When somebody gives you a document that we're going to be the best communicators in the world, we're going to make sure we're very proficient, we got to edit it for grammar and spelling. And we got people who, out of 25 people, were, you know, they bless us with 6, and they're coming and going. I don't know how this is all going to turn out. All I'm going to tell you is this looks like a big problem to me. You're a $115 million project may be best served by cutting your losses. And I think the department would be well served to figure that out very quickly in terms of whether they can perform. And I don't know if if that's going to be something that you're going to learn from the Gardner Group or not. But my view on this is you shouldn't be thinking we're going to be with these guys for 5 years, given the current projection. I mean, their current projection, their current performance, we shouldn't be with them for another 5 days. So unless there's been huge performance changes, my suggestion as a member of this audit committee and just following up on a basic report from our auditors is this is a major breach of contract. It's a major bait and switch. And unless there's major performance improvements, like within, I would say, 30 days, you got to make a change. You got to send them a demand letter and say, here are the following 18 things you got to do to perform. And if you don't perform those within 30 days, we are hereby terminating our contracts. We'll mitigate our damages, and we'll go find somebody.
Madam Secretary, any questions or comments?
Not after that, no, thank you, sir.
Director Albertson?
Yes.
Yeah, would you like to respond? Yeah.
I'm sorry?
Did you want to respond to
No,
that?
just thank you, Mr. Lieutenant Governor, for those comments. And yes, we are very aware of the serious nature of this project and also the high profile and importance of this to the state of Nevada. And I just want to assure the committee that we are doing our due diligence to work with our contractor to ensure delivery of the system modernization effort. But again, recognize the concerns and the issues that you brought forth, and that is actually what initiated this audit in the first place, was because we were made aware by staff, internal and external, of some issues that potentially were going on with this project. And so again, with the assistance of the audit team and now with the Gartner Group, we hope to have a point in time very soon where those decisions will be made and we'll move forward.
Thank you. Thank you, Madam Director. And I applaud the DMV's efforts in that regard. I guess I direct my passion to the vendor, who I think engaged in some activity and conduct that is highly inappropriate during the RFP process in terms of what they promised they would deliver and they never did. Thank you.
Thank you.
Mr. Treasurer, did you have a comment?
Yes, thank you, Governor. I'm just referring to a comment that the Attorney General made earlier that he wanted to continue the discussion offline. Does that suggest that you might have some insights that might be useful to the committee into this contract?
You don't need to respond to that, Mr. Attorney General. Okay. Any other questions on this agenda?
Governor?
Yes,
Governor,
Madam Secretary.
I just want to ask Ms. Albertson if this has anything to do with the elections upgrade that we've been working with the DMV on.
For the record, Terry Albertson, Madam Secretary, no, it does not.
Great, thank you.
Any other questions with regard to this agenda item? All right, thank you, Director. Thank you. We'll move on to the next agenda item, and I'm going to start moving a little faster because my understanding is that the Secretary of State may have to excuse herself at 4:15. Is that correct, Madam Secretary?
Yes, Governor, thank you.
Okay. So we'll move on to agenda item 4F, the Governor's Office of Economic Development. Ms. Brecken, good afternoon.
Good afternoon again, Governor and committee members. For the record, Catherine Brecken. Here representing the Governor's Office of Economic Development is Director Steve Hill and Deputy Director Corey Hunt. At the request of the committee, we audited the Governor's Office of Economic Development, or GOED's, procedures for approving and monitoring transferable tax credits for and abatements of taxes on qualified economic development projects. In September 2014 and December 2015, the legislature approved requirements a participant must meet in order to receive transferable tax credits and abatements for projects that invested $3.5 billion and $1 billion respectively. The legislation also included protections such as the choice to set aside the abated taxes in a trust fund. In regards to the billion-dollar project which qualified in Southern Nevada, GOED used the trust fund option to prevent tax dollars from being committed before all requirements were met. Even though the billion-dollar project was not realized, the state benefited by $11 million. Although the policies and procedures employed by GOED ensured all statutory requirements were met, we made one recommendation to improve procedures for approving and monitoring qualified projects. We recommend GOED develop a consolidated due diligence checklist. GOED has a process for ensuring statutory requirements are met. However, GOED does not have a formalized document that identifies what documents were reviewed, who reviewed the documents, and the date of review. A consolidated due diligence checklist which documents who reviewed, whether the application satisfied all applicable requirements, what documentation was reviewed, and the date of review will increase accountability and transparency and allow GOED leadership to track the documentation and review process. We'd like to thank GOED for their time and help throughout the audit. We'd be happy to answer questions the committee may have.
Okay. First, any questions for audit from committee members? Okay, Director Hill.
Thank you, Governor. Members of the committee, I'm Steve Hill. I'm the Director of the Governor's Office of Economic Development. I'd like to thank the Audit Department for their significant work on this effort. We appreciate the suggestion that they made. We have implemented that recommendation already. And to kind of follow up and address the controller's point, we certainly consider qualified projects. Any qualified project has to be at least $1 billion or more to be the responsibility of the executive director. We also have a director of business development who would do a significant portion of this work, and those would be the two people responsible for following through with the project, as well as initially off and signing off on the checklist.
Thank you, Director Hill. Questions from committee members? Mr. Treasurer.
Thank you, Governor. Thank you, Committee. Thank you, Mr. Hill. I have some disagreements with your recommendation, but just so I better understand the situation, there's nothing in here that suggests that you're looking at any sort of financial reports or financial plans from any of the recipients of the tax abatements that you've offered. Is that a correct understanding?
Mr. Treasurer, Steve Hill. There's no legal requirement that we do that. In each of the two cases that we've had, we have looked at the financial records of the company.
But that seems to be contrary to what's in the audit report, where they say that no audits were done because the project hadn't progressed far enough.
Yeah. Mr. Treasurer, Steve Hill, perhaps I'm not understanding the question correctly or answering it very clearly. In consideration of the company's application and what we present to the board, we looked at the financial statements of each of the two qualified project companies. Following that approval and the implementation of the project by the company, there are requirements for audits periodically. It's annually, although they are permitted to do them more frequently. In Tesla's case, they have performed and submitted a number of audits. In Faraday's case, they did not reach the stage of an annual audit before withdrawing from the project.
Good. Again, a question just, and this goes to the text of the recommendations here. Why do you think that they did not, in other words, that they did not reach the stage of your requesting an audit? And I guess the point I'm getting at is that obviously the Treasurer's Office was asked to provide some financing. We got a verbal request for that, but we never got anything formally. But why is it that you think they never provided those audits?
Mr. Treasurer, Steve Hill, GOED did not request from your office financing on this project at any time. I don't know if someone else did. We did not.
someone else did. I mean, it was an informal request. And the reason is that it wasn't, that they didn't continue to request it, was that the project continued to be unfinished, and this just continued over time. I know in the interest, the governor wants to move on. I would like to add a request to the committee's recommendation, and I went offline. I think Mr. Warren has a copy, but Mr. Hill, it's difficult to understand how you can monitor a project where you don't have financial reports. And this is again a year old, but and we may expect something earlier or something later, but really since the end of 2014, all I can see from your annual report to the legislature is audit pending. So in effect, you haven't received financial reports from any of the participants, any of the people that you funded, or any of the people that you have granted, you've given tax abatements for. And I guess my question is, do you feel handicapped at all? In other words, any private venture capitalist would require monthly meetings, let alone 6-month audits or yearly audits, let alone 2 years or 5-year audits. And I guess it's just difficult for me to see how you can possibly monitor what is happening in your agency.
Mr. Treasurer, Steve Hill. I would invite you, if you would like, to come and look at or come and talk about how we do that. The legislation, I believe, is very clear. There are criteria that companies need to meet in order to be eligible for either tax abatements or transferable tax credits. We have everything that we need at our disposal, including company-paid audits, in order to both monitor that and determine what has been earned and granted and the time frame for that. In the particular case of Faraday, we created a trust fund so that they would not receive those abatements until they met all of the criteria they needed in order to earn them. So no, I do not feel that we are handicapped. And I feel that both projects, while one is proceeding very well and the other did not, the outcome for the state of Nevada was not negative in either case.
Again, I would add, and this goes back to the audit committee, is that in just looking at one of the exhibits on page 17 of 18, it says financial statements are not required by statute. So again, I'm just mystified how GOED can really not only award these abatements and these tax benefits and funding, for example, in the case of Faraday, when it's been years since you've seen an audit, and again, this is just from your own report, okay? So you may have reports that are not, I'm not accusing you of anything, but for whatever reason you don't disclose or you don't tell people about, but the written record suggests that there are no audits every 2 years or every 5 years. I understand that financial statements are not required, but I cannot understand how you can really monitor the projects that you approve. And what I was hoping too, as I know this report focuses on Faraday and Tesla, but there's a whole raft of other commitments that you make. And maybe this is a question for the committee here. Did you look at any of these other commitments? Was that within the scope of the audit?
Mr. Treasurer, Warren Lohman for the record. The scope of the audit was simply for the $1 billion and the $3 billion investments.
Okay, so I'm speaking outside of the scope of the audit, but any venture capital, any private venture capital group, anyone who has anything to do with this type of funding, and in this case, tax abatements, and I'm not suggesting that you have an audit every 6 months or every year. You can do a compilation. I mean, it doesn't have to be a full audit, but it seems clear to me, not only from what you've said, We obviously can't talk about everything else that's out there, but there are just no controls on your agency. And, you know, you can respond to that, but I just don't see them.
Mr. Treasurer, Steve Hill, I just don't agree with that.
I understand you don't agree, but there's no proof of why you disagree. In other words, you feel that through intuition or through us, and I'm not being facetious, osmosis, you can understand what's happening within the agency when you receive absolutely no written verification, no written reports of what's happening financially.
Mr. Treasurer, Steve Hill, let's make sure that at least the facts are clear. We receive audits from Tesla on a very regular basis.
I'm not talking about Tesla, I'm talking about Faraday and the others.
Okay.
Yeah.
And in this particular set of audits, there's only 2 projects, the other being Faraday. The reason we did not receive an audit from Faraday is the project was suspended and the abatements withdrawn prior to their responsibility to turn in that first audit. If they had proceeded forward, we would have received that audit. With respect to every other project that we provide incentives, the Department of Taxation audits those companies after year 2 and 5, and all of that information is available on our website, and it's out there.
And I'm suggesting that an audit every 2 years or every 5 years is wholly inadequate for what your agency is supposed to do and what should be doing. Again, I know this probably goes to statutory language, but you know, it just baffles me that you would be able to award the abatements that you do, that you would be able to award the incentives you do, that you would be able to give whatever financing that you do without that information. And I don't know whether the audit committee can somehow include that in, I think the due diligence list is an excellent idea, long overdue, but I think there ought to be a follow-up there that suggests that GOED really pay somewhat attention to how these companies who receive benefits from GOED report to you.
I mean, I guess I'll say this, and Mr. Director Hill, you're in a better position to respond, but any implication or suggestion that all of this was done in a black box or without any information before it was considered by the GOED committee is just simply untrue. And the scope of this audit was at your request. We did this audit and audited these 2 items and that threshold at your request. There was no suggestion otherwise. So Director Hill, again, I mean, I chair the committee, and without exception, have we ever approved a project without having sufficient, or not just sufficient, but more than sufficient financial information before any type of abatement or tax credit was provided?
Governor, Steve Hill, no, we have not.
Again, Governor, I would beg to disagree with you on Faraday, but that's another question for another time. But I'm also talking on an ongoing basis, is that you've awarded the abatements, you've awarded the tax benefits. There should be some criterion, there should be some basis that you can audit or understand what is happening in all of these companies, and these are, I don't know how many other, 20, 30, 40, 50 companies that you award these to, that gives you some understanding or some basis that these companies are performing and that they've merited the incentives that you've given them.
Mr. Treasurer, Steve Hill, those criteria are outlined in law, and we follow each one of those criteria on every company that we both bring to the GOED board, and that's what those audits show. The criteria for earning those abatements are measured in that 2 and 5 year time frame, which is why we audit at those 2 and 5 year time frames.
Okay, I think I've made my point, so thank you.
I don't know what your point is, Mr.
My point is that there's no transparency here, that that GOED does not have the financial reports that enables them to monitor the progress of the companies that they've given these incentives to. And I think that if GoEd wants to be a venture capital firm or a private equity firm, they need to do that. A 2-year and a 5-year audit is wholly inadequate, and they're not even done. I mean, if you look here, it says audit pending. So whatever small amount of financial reporting is required hasn't even been done. So I just, as I said, I don't know. I was trying to find out what the total amount of incentives that you've given are. Maybe you have that information. But, you know, again, there's no accountability, there's no transparency, and again, no personal disrespect intended, but you go about happy as a clam, giving these abatements, giving these incentives, and we as taxpayers have no idea as to whether they were earned, whether the companies that you've given these to should receive these benefits, and actually whether the taxpayers and the people of Nevada have done a good job. And that's my point.
Mr. Treasurer, Steve Hill. Again, let's make sure the facts are correct. I mean, we can disagree about what our role is. Every one of these companies is audited. That is completely reported. It is available on our website. All of those audits are on our website. That is all outlined in law, and it is followed in every instance. So
the question is, when are they audited?
The idea that there is no transparency or accountability to the law is incorrect. That information is available. If you would like us to send it to you, we can do that. If you do not want to look at it on our website.
I'm not disagreeing that there's an audit. The question is, when is it? And an audit 2, 3, 4, 5 years later, and maybe what you're saying is that that's the statutory requirement, to me is wholly inadequate for you to do the job that you have been mandated to do.
Treasurer Steve Hill, the incentives that we provide company are performance-based. So the 2 and 5 year periods are the time in which they have to perform in order to actually earn the incentive.
And I would submit to you that were this a private venture capital or private equity group, they would not only disagree with you, they would say, we want to see this every month. And again, I agree that that's probably overkill, but what you have set out as your paradigm, to me, does not seem to meet what the mandate that you've been given.
Treasurer Steve Hill, I don't know if the implication is that you think we have been given a mandate to be a private equity firm. That is not the case. It is not the role that we play, and we don't pick winners and losers along those lines, which is what a private equity firm would do. So our responsibility is to make sure that the company meets the criteria that they have to meet in order to earn the incentive. We do not pick winners and losers as a private equity firm would do.
I'm arguing that in effect you do, but that's a discussion for perhaps another time.
Okay.
So, thank
I
you.
think
Yeah,
we've had enough.
Yeah.
All right, any other questions or comments for Director Hill?
Governor?
Yeah, Mr. Lieutenant Governor.
Thank you. Mr. Hill, thank you very much for being here. I have the pleasure of sitting on the Board of Economic Development and hearing these reports that you give to us as a board on a regular basis. And perhaps it may be helpful so that the record's clear for you to just describe whether or not any tax dollars concerning abatements or incentives for Faraday were ever at risk based on Faraday's performance or failure to perform or provide audits or documentation. If you could just maybe capsulize how it was that GoEd handled tax dollars and the steps that GoEd took to ensure the safeguarding of tax dollars, I think that may be helpful for the record.
Mr. Lieutenant Governor Steve Hill, yes, we recognized, and Faraday understood, they cooperated with us on this, that there was risk associated with their project. We thought that the potential benefit was great, and that if we could eliminate the risk associated with Faraday from a state standpoint, that the potential benefit was worth moving forward. And as we pointed out, we also have a pretty significant deficit in southern Nevada when it comes to large parcels of ground. So the project would also open up a big portion of Apex for development for other projects, which was important too. Because we recognize that risk, we asked the legislature, and they agreed that to put the trust fund concept into law, and allowed us the discretion to structure that trust fund to either minimize or eliminate the risk to the state. We had at one point $16,000 that had been kept by Faraday. It was a partial abatement of the modified business tax. All of the other potentially, the taxes that would potentially be abated were paid to that trust fund. We asked them to repay that $16,000 that they had kept as an abatement, which they did. They wrote a check to the trust fund. So other than that $16,000, there was never risk to the state. In addition to that, we required that Faraday perform all the engineering work for the infrastructure that would have been put in at Apex. The alternative would have been to have the agencies front that engineering cost. And the way that typically works is the engineering's done when the bonds are issued, and it takes engineering work in order to get a cost estimate so that you can go bond the project. Typically then that engineering work is repaid as a part of the bond funding. Because we weren't sure that we would get to the end of the road on this project, we asked Faraday to pay for that engineering work. If that bonding had taken place, if North Las Vegas had filed an economic development financing proposal with us, if our board had approved it, and if then we had asked the treasurer in his office to issue bonds, then Faraday would have been eligible for repayment of that engineering expense. That obviously has not happened. We do have the benefit, though, of having that engineering work done, and we still are optimistic that we can find a qualified project in the Apex area and follow through with that bonding.
I'm on mute. Sorry, Governor. And Director Hill, I've heard you repeat essentially what you've just stated for us as an audit committee publicly before. You brought it before the Board of Economic Development in the same basic idea, the basic light, that information. I've heard you repeat it repeatedly throughout the course of the Faraday project to the public on numerous occasions. And so from one member's standpoint, transparency has never been an issue for Director Hill or for GOED on Faraday. Accountability has never been an issue from my perspective because the tax dollars were placed in trust funds, completely accounted for. Faraday did not get the benefit of those incentives until they performed. And all of the requirements of the statutory scheme that was put in place so that this state could come out of the Great Recession and benefit and be blessed with the jobs and the opportunities that the state has seen, I think have been satisfied. And I think that the results of the tax abatement program, the tax incentive program, the way it's been administered by GOED, the way it's been managed by the governor's office as well as the Board of Economic Development, and the transparency that has taken place speaks for itself. We've had a tremendous amount of success in incentivizing companies to create jobs for Nevadans. I've heard the governor say when GOED was created, they just dreamed of creating 50,000 jobs. And if that could just somehow happen in the state of Nevada, and we've surpassed that by 3, 4, what is it, Governor? I can't remember how many times we've surpassed that. I know you got on top of your tongue.
It's nearly 5 times now, Lieutenant Governor.
I mean, nearly 5 times that. I mean, let's put that in perspective in terms of what a job means for a Nevadan. And when this GOED concept was developed, we were praying for 50,000 jobs. And now we've got 5 times that amount. And The taxpayers have been well served. There has been transparency, there's been accountability, there's been financial prudence, and I've sat on that board. The governor's directed it from the beginning. Mr. Hill has directed it from the beginning, and I just want to applaud you, Director Hill, for a job well done. We're going to be losing you soon, and Nevada's a much, much better place and a much stronger place because of your service. Thank you.
Thank you, Mr. Lieutenant Governor. Madam Secretary, do you have any questions or comments?
No, thank you, Governor.
All right, anything else? Mr. Attorney General.
Just one thing. I just want to make a distinction that, in the case of a private equity firm, they're actually putting the money out in the front end, and that's why they would be tracking much more diligently as they decide to continue to reinvest throughout the course of a project. In this case, certainly for Faraday, all the money was held, nothing was given out, so it makes sense that, at least structurally, these are set up in a different way.
Governor,
Mr. Controller. Mr. Controller.
Thank you, Governor. Mr. Hill, good afternoon, and I'll try to be real quick. I'm sure it wouldn't surprise you if I said that these matters are of great public interest and somewhat controversial from time to time, and that the public, taxpayers, people, maybe even the press, would like to look closely into them, and not just at the 2- and 5-year mark to see whether an audited report shows that the participants have done everything they're supposed to and have gotten only what they're supposed to, et cetera, but on a prospective basis at the time the decisions are made by GOED to make these commitments. The Attorney General says we're not putting money up front. That's true, but we are making commitments and we are incurring risks thereby. And so my question is this. If I'm just John Q. taxpayer and I go to your website, which you referred to a couple of times that the information is there, on any one of these projects, can I find a full compilation from beginning to end of what information was provided to the state and what information and documentation GOED and the state relied on in making these commitments and entering into these agreements and providing these abatements? Can someone find a full file on any one of these projects so that they can review it from beginning to the current day?
Mr. Controller, Steve Hill, yeah, the answer is yes. That information is on our website. It is a matter of public record because we post it ahead of the GOED board meetings. It's presented to the GOED board, and it is a part of the permanent public record.
That's great. Can I take you up on your offer to Mr. Schwartz that you could provide me with an example of that so that I could go through it?
Mr. Controller, Steve Hill, absolutely.
Thank you. I'll look for that in my email. Governor, with that said, I know this is only an information item, but I think it would be reasonable and appropriate to continue this item to the next agenda so that we can basically report back on that.
I think it's beyond the scope of this agenda item, so I don't see any reason to continue it. Mr. Treasurer.
Thank you, Governor. One final comment. Contrary to what Mr. Lieutenant Governor said and what the Attorney General said, had we issued those $175 million in bonds, and we didn't, but had we done it, and the Treasurer's Office was urged to do it by Faraday, they would have defaulted on July 10th. The taxpayer would have been out $175 million in general obligation bonds. So again, this is money that would have been invested by the people of this state, and had the Treasurer's Office been less concerned about what was happening, we would have been on the hook for $175 million. Thank you.
Governor Steve Hill, if I could just respond to that, I don't think, I mean, Faraday may well have asked, but they have no standing to ask. The bonding process requires an economic development financing proposal from a local jurisdiction, a city or a county. It has to come through us. It has to go through to the board of the Governor's Office of Economic Development and then go to the treasurer. So Faraday, I don't dispute that they may have asked, but that shouldn't have been a concern.
They not only asked, they assumed it was going to be issued, but it wasn't.
Anything further from the audit? All right, thank you. Thank you, Director Hill. Let's move to the next agenda item, which is Department of Education, report number 18-06. Please proceed.
Governor and members of the committee, for the record, my name is Lynette Aaron. Here from the Department of Education are Superintendent Steve Canavero and Deputy Superintendent Roger Rami. Our audit focused on improving the efficiency and effectiveness of the grant management process for the 2015 education initiatives. In 2015, the legislature approved almost $335 million in general funds through various grant programs to support the department's education initiatives in early learners, modernizing the Nevada plan, middle school and high school, and investing in change. In 2016, an independent evaluation was performed to evaluate 7 of these programs in areas such as quality of educators, student achievement and growth, school safety and climate, and technology use in education. The evaluation recommended continued funding for all programs because they were achieving the educational outcomes intended by the initiatives. Thus, our audit evaluated the grant management process for 12 state general fund grant programs by focusing our review on recipient monitoring. 7 of the 12 grant programs were reviewed to evaluate their fiscal controls. Based on our review, we offered 3 recommendations. First, the department should develop a department-wide risk assessment for grant management. This will provide a framework for evaluating grant programs and help allocate limited resources in grant management. None of the 12 grant programs had written procedures for assessing risk during the pre-award and post-award phases of the grant process. Additionally, the department does not have sufficient staff and travel fund resources to fully monitor the 12 grant programs we reviewed. Legislation provided the department with resources to monitor some of the grants. However, the department had to absorb costs associated with monitoring other grants. Using a risk assessment would help the department determine which grant programs and recipients weren't using their limited funds for monitoring activities as part of their grant management responsibilities. Second, the department should develop a department-wide recipient monitoring policy to ensure grant programs are achieving goals and objectives. Monitoring recipients allows program offices to ensure effective and consistent management protocols within grant programs. The department does not have a standardized department-wide policy for recipient program monitoring. Recipient monitoring is a responsibility of each program office, and each program office has its own policies and procedures for monitoring its respective grant programs. Based on our review, the procedures for performing recipient program monitoring varied in scope or were not performed at all in the program offices we interviewed and or visited. 5 of 12 programs did not perform any on-site or desktop monitoring. 1 of 12 programs had areas in which on-site or desktop monitoring could be improved. Recipient monitoring did not start until fiscal year 2017 for that program. Without monitoring, program offices are not able to identify deficiencies within the grant program and report those deficiencies to recipients. Meeting criteria such as on-site desktop monitoring, providing audit and performance reports, and requiring corrective action plans, as well as consistent reviews, helps ensure grant programs are achieving goals and objectives. Third, the department should improve fiscal monitoring. Improving fiscal monitoring will help ensure recipient expenditures are allowable, valid, and appropriate based on program goals and objectives. Recipients are not providing sufficient expenditure documentation to the department to ensure expenditures are appropriate based on program goals and objectives. Additionally, the department is inadequately reviewing documentation received from recipients. Improving fiscal monitoring will also help ensure contractors are properly classified and adequately monitored. The department misclassified relationships with 2 vendors receiving grant funds as recipients rather than contractors. Not properly classifying these 2 vendors as contractors resulted in state general funds awarded without following state contracting requirements to include Board of Examiners approval. The department does not have a standardized department-wide policy in place for contract monitoring. Consequently, the department did not monitor recipients to ensure they were following state contract procurement guidelines and did not review contractor invoices when reimbursing recipients for contract expenses. Improving fiscal monitoring will also ensure grant funds issued to recipients are properly accounted for. The department did not reconcile recipients' annual reports of revenues and expenditures for state grant programs to the state accounting system to ensure funds issued to recipients were properly accounted for. Without reconciling recipients' annual reports of revenues and expenditures to the state accounting system, the department may be unaware of whether recipients spent all of the funds awarded to them. In one program, 9 of 13 recipients did not provide an annual report of revenues and expenditures for fiscal year 2016. By having effective management protocols and tools, the department can ensure grant programs are achieving goals and objectives efficiently and funds are being spent appropriately. We appreciate the department's assistance and cooperation throughout our audit and thank them for their time and consideration. We are happy to answer any questions.
Thank you very much. Any questions from committee members for the Audit Division? Okay. Dr. Canavero.
Thank you, Governor, members of the committee. Steve Canavero, State Superintendent of Public Instruction, and thank you to Ms. Aaron, Mr. Lohman, and Administrator Weinberger for their audit and for their work. I think I surprised them when I had about 20-ish people at the exit meeting, principally because this matters. This really matters. It matters to the department on 2 levels. And on the first, at the end of the 2015 legislative session, we knew that we were obligated to ensure that the programs increase outcomes for kids. So the performance of the categorical programs was something we began working on and continue to work on today. And I think it's validated by the external audit or the external disinterested third party who conducted the review and will continue to conduct the review. And our internal analysis also shows that much of the grant work under question, in discussion here in this audit, are improving the lives of our kids in our schools and our school system. But it also matters because we knew at the same time with the increase in categorical investments, it was going to press the department. It was going to press the department and our ability to ensure that our grants unit and our program side, whether it be communication or processes and policies, would be put to the test with the given workload and the given demand upon us. And I think the new investments, incredibly grateful for those new investments, they did demonstrate some cracks in our systems. In early 2016 through really into early 2017, we leveraged our federally funded regional lab to come in and provide expertise and expert consulting on how to develop grant systems that are both in consideration of the recipient. Many of our recipient school districts have publicly testified at how difficult it is to apply for grants with the agency and how many different grants there are. So trying to increase the efficiency of that process while not sacrificing our obligation as financial stewards of those dollars. And we're grateful as well for the additional individuals that came with those categorical programs in 2015, most of which are program professionals, folks to help support districts in the standing up of these programs, with a few also, I think 2 or 3 grants analysts and management analysts as well to help us on the backside to do the type of fiscal reporting and monitoring that we're obligated to do. I'm confident, based upon where we are, the advice that we've been given, the direction with this audit. The good news is that it reconciles very much with what we know the work that we need to do and that we have been working on. So there's no real surprises here for us, and we're actively pursuing really the three core recommendations here. We obviously accept or acknowledge, or whatever the right word is, the recommendations, and are working to clear those. And in the 6-month review, we believe, and I think in our response, you see July 1st of 2018, we'll have the system stood up to ensure that the uniform risk assessment, to ensure we have a uniform monitoring policy across the department, and shore up the fiscal monitoring systems that include the contracts as well. So a lot of it is in the rearview mirror, but we still have work to do, frankly, and we're committed to getting that work done. I'll close with that and then move on to questions.
Thank you, Dr. Canavero. And we just approved some contracts, I believe last week, that are consistent with what's discussed here. So my impression is those would be complementary to the audit that was just completed here by internal audit.
Steve Canavero, thank you for the question, Governor. I see two discussions here, two measurements, if you will. One is around the performance. Are students learning? Are there more teachers in classrooms? Is the pipeline for teacher education expanding? That is the contract that you approved at the Board of Examiners meeting. That is the disinterested third party. That is one line of work, the outcomes. This particular, it is complementary to this audit in that they cover in the same subjects, the same 7, now 8 under the SB 178, but the seven categorical programs installed in 2015. Here, specifically, they're looking at our, obviously, as you know, sir, they're looking at our fiscal controls and our fiscal systems, not so much on outcomes for kids.
Questions from other committee members? Mr. Treasurer.
Thank you, Governor. First of all, I want to thank the Audit Committee, and I think these, and I'll keep this short because I know we're time constrained. I think the executive branch is really upholding its way to tripartite stool of government. I think it's been excellent, sir. Why are we at the bottom of every report on education? 50 out of 50, 50 out of 50, 49 out of 50. Any insights?
Certainly, Steve Canavero. So I think a variety of reasons, and you're actually going to see another report that's going to come out, I think, at midnight tonight with no change for Nevada, principally because it's looking in the rearview mirror. It is actually looking at 2015 data, and I think you'll also see a press release from me that says, you know, that's in the increased accountability and investments that have been made in 2015 and then continued in 2017. Frankly, I see a bright future. All of our leading indicators show that our goal, the state's goal to be the fastest improving state in the nation, that we're actually making progress. We see improvement in mathematics with our Smarter Balanced Assessment. We see comparisons like the categorical program to support children in poverty, the Victory schools outperforming their similarly situated peers, meaning a Victory school that receives the investment and then a school that has similar levels of poverty that does not. And we see a tremendous gap between those schools where the Victory school clearly outperforms. We see expanded GATE programming. We see expanded results for AP. We know we're one of the top states in growth for AP tests, and that's just not in giving, but that's also passing, which are two indicators you seldom see together, which means to me that we're beginning to capture some of the capacity within our kids that has been on the table for quite some time. We see that for growth in African American Black students in access and pass rates to AP, as well as our Native American students, which are two groups that we specifically target with funding from the College and Career Readiness Grant, one of the grants that we see here. So technically, if you look at the report that will be released tonight by a national group, we are, I think, 39th in K-12 or pre-K through 12th grade education. Aggregate, though, of course, we're at the bottom. But again, that's the most recent data is 2015, doesn't even recognize the new investments that were made in 2015 and again in 2017, and doesn't recognize the increase in academic achievement based on NAEP. So I'm bullish, and I know that that's a long shot to ask you to trust there, but I'm bullish, and we have some evidence to support that.
Okay. I'm glad to hear that you're bullish.
Superintendent, I'm bullish too, and I appreciate your work, and some future governor's gonna see the benefits of this, because when you look back at the gains that were made in post-2015 that we all know that are happening, you're gonna see a dramatic change. I mean, we can talk about the graduation rates and the improvement in the graduation rates that we reported was plus 80% statewide. What was the exact number, Mr. Superintendent?
I think it was 80.9%, almost 81%.
I think we were at 59, not too long ago.
Yep, as far back as 2012 was 60%.
So as I said, it's time, it takes time, and, I get it, I guess, from a narrow perspective, you could say that, what the treasurer has suggested, but I think in a future analysis and a current analysis, frankly, we're going to see improvements and are seeing improvements as we speak. Mr. Controller.
Thank you, Governor. Director Canavero, excuse me. I'll bet a lot of people make that error. Dr. Canavero, looking at page 18 of 19 under corrective action number 3, the second bullet and the fourth bullet don't tell me any time frame when to expect something reported back on them. The first one and the third one reference item or corrective actions 1 and 2, which have dates associated with them. I think it's July 1st. Can you give me some feeling for a time frame on the second and fourth bullets?
Mr. Controller, Steve Canavero, I've been called a lot worse, so don't worry about the pronunciation. And you're referring to our response or our response to the corrective action?
Yes, I'm referring at page 18 to your response, corrective action number 3. It's titled at the top.
So
it doesn't have your signature, but yes, I'm going to attribute it to you.
No, Steve Canavero, I did see it. So the corrective action responses under number 3, we believe build off of 1 and 2 concurrently, and July 1st, 2018. When you had given the critique of the former response, I took some notes, and the individual who's responsible is to my right. It's Roger Roming, the Deputy Superintendent for Fiscal Services.
So we will be coming back to this in 6 months, and will we have some more detailed reports on the second and fourth bullets at that time?
Steve Canavero, I'm confident you will. We'll submit to the audit staff. We hope to engage the audit staff in some of this work. In working with the audit staff, it's very important to understand the target, whether we can all agree that risk assessment's important and monitoring's important. Terms of materiality are important, and those are some of the levels of detail that we're getting to, and we'd love to continue to engage with the Governor's Finance Office and the auditors as we develop our systems to make sure that for the next audit that we are hitting the mark and target that they see as well, absent some clear other guidance from SAM or otherwise. So yes, we'll have it to you.
I'll look forward to that. Let me turn to one other item. It's this question of what we've done and what progress we're making, and for that matter, just as important, where we are. I'm glad to hear that we've eclipsed, as of midnight tonight, the 40 mark and moved into 39th, and I say that in all sincerity because, in fact, despite the fact that some people find it amusing or find it suitable for their political purposes to say that, and I don't refer to the treasurer here, to say that we're last in everything good and first in everything bad. We're not. And K-12 education in Nevada is not. Unfortunately, where we are has been roughly 41, 42, 43 on a sustained basis. And that's not good. It's not what we want for the future of our state and our economy and our children especially. And I realize that you all are working hard to improve that, and please do. The other part of this is that besides hearing the mischaracterization that we're last, you hear the mischaracterization. In particular, one assembly member a few years ago said that in his time, this was about 2011, in his time here, he had witnessed the systematic destruction of K-12 education in Nevada due to underfunding. That's simply not true either. In fact, in the last 10 years, and I'm not even talking about what'll happen going forward in response to the initiatives we've undertaken in the last 2 years, but in the last 10, 11 years, K-12 is the only state funding that has increased in real terms except for health and social sciences. And you've increased substantially as the incomes of Nevada families and businesses have gone down by about 8 or 9% per person in real terms. On the same basis, K-12 funding has gone up something like 16, 17, or 18%, and that's been documented here, and it will be documented again in this year's report, which will be out soon. So I guess what I'm asking you is, since the fact is that we've contributed substantial new resources over an 10, 11, 12-year period, but we haven't seen much progress, can you tell me why it is we're hopeful that more resources contributed in the last 2 years will turn the corner?
Steve Canvero to Mr. Controller. Thank you. Agree with all of what you just said and appreciate you putting that out there. The reason why I'm optimistic looking forward, one, it's just empirically that way. There's good reason to look at the numbers, and the numbers that we see are strong, and whether that's early learners and access to high quality early learning centers, or whether that's students who speak a language other than English and how quickly they acquire English. So that's one reason, right? The numbers are there, and perhaps it takes a significant amount of time in order to see that type of change with our school districts and with our classrooms and with our kids. The other reason why I think we're seeing, I think, a pretty quick turn here on some of these investments. It was I think, a fine work from the governor and his leadership, balancing investments with accountability. And so the dollars flow out in a categorical, meaning that they're sort of fenced in dollars that can be used for very specific purposes. Those purposes, those things, if you will, that school districts can buy or how they can serve their children are enumerated in a bill, and some of the districts don't like that. But at the end of the day, it provides a very clear opportunity for our districts to serve kids and consistent with the law, and then allows us to measure that. It allows the state to establish performance targets, which the state board has done for, just a couple of examples, our Zoom schools and our Victory schools, Zoom with high English learner populations and Victory with poverty. And it allows us to put a clear emphasis on student outcomes that I think has somewhat been obscured by the State Department of Ed's role, which I think over that from 9, 11, and 13 has changed dramatically. And I think in 15 and 17, I think we've shown that when we talk about kids and talk about outcomes, we actually mean it, and we have the data and the accountability provisions. So I think that's one of the promising practices that we can learn from as a state going forward. And then knowing when to turn that accountability off, when the system's been built at the district. Again, kind of zooming way out to look at the 10 or 11-year plan on sort of modernizing the Nevada plan, and then incorporating those dollars into the actual formula. So I hope that gives you some answer.
It definitely does give me an answer, and it's an answer I appreciate and thank you for. Final question. In referring to 39 through 44, et cetera, most of the time people are talking about the NAEP results, that sometimes other similar things, which measure what we ought to be measuring, which is outcomes, outputs, not inputs. Utah does a great job next door with much less inputs, as we all know. And we could have a long colloquy on that, but we won't. But looking at NAEP and other measures, and you can tell me any others, short of 11 years out, in the next 4 to 5 years, based on what we're doing and what we've done in the last 2 years, what kind of results and improvements can we expect when? If we're sitting here 5 years from now, 4 years from now, what should we expect and hope to see as a result of what we've done the last 2 years?
Steve Canavero, thank you, Mr. Controller. My hypothesis on the NAEP is going to be continued growth. Just as a point of fact, the last NAEP assessment, our 8th graders were called out for the, and our state was called out for our 8th grade students for the gap closure. So the closure, the distance between our 8th graders and the nation, we closed it we're, I think, one of 3 states to close it significantly. So my hypothesis of the next, let's say, 5 years, if we continue to stay the course, and by stay the course, I mean that we talk about refinement, we don't talk about massive, significant shifts, and we can demonstrate that the system that's in place now will work, is that we will see NAEP climb. We will, if we're the fastest, if we're meeting our measures to be the fastest improving state in the nation, we will be there in 5 years. We will be the fastest improving state in the nation within 5 years, and what we use to measure that are nationally or a consortium of states. It's not just Nevada compared to Nevada, but it's Nevada compared to all of those states in our testing consortium, all of the AP, things that the nation measures and that we can see across the nation and compare ourselves. So that's our strategic plan. I think we can get there in 5 years.
Thank you. Thank you, Governor.
Thank you. Questions from Southern Nevada, Mr. Lieutenant Governor.
Thank you, Governor. Mr. Superintendent, thank you for being here today, and thank you for all of your tremendous service to the state of Nevada. I just really have kind of a practical question for you because it stems from the audit report itself, and it really recognizes a challenge that you have with these kind of audits. If you have a whole bunch of administrators running around ensuring that the grant program is perfectly being administered, then you're criticized because you've got too much middle management, too much administrative staff. And then when you try to focus where the resources need to be in terms of teaching resources and the principals and right there at the school level, sometimes, you got to shift staffing around and resources around to where you can't maybe address all the issues that maybe a more heavily loaded administrative staff would provide for you. And so the audit reflects that. It says that the department does not have sufficient staff and travel funds resources to fully monitor the 12 grant programs we reviewed, and it was very candid in terms of saying adequate staffing and travel funds are necessary to ensure proper oversight of the grant programs. The audit cites that grant programs on average have 15 recipients, and even quoted one staff member as saying that she managed 23 recipients of grants, and that included over 300 schools during fiscal year 2017. I mean, that's a tall order for you, Mr. Superintendent. And so it's just really a practical question. You have been good to accept the recommendations of the audit committee to set forth corrective actions, but how are you going to do that just in light of what the audit reveals and what you know, and that is just limited resources?
Thank you, Lieutenant Governor. Steve Canavero. Yeah, a very real tension that you point out between what the audit report is asking and the depth of reviews. Even when I read the review related to the contracts and sort of the chain of custody of state dollars as they move down and through the system, how far we have to sample or where our obligation starts and stops. So we're hopeful as we continue to build out the real detail with the monitoring and engage with GFO and the audit team, we have to find efficiencies. Plain and simple, we have to find efficiencies. To the extent that we can find efficiencies, that somewhat answers your question, but I do believe there's going to be a difference, right? There's going to be a delta between that which we believe we can professionally manage and that which we cannot. And then what types of shortcuts, if you will, for lack of a better term, that we can or can't make. and what that might do. I know it's put a tremendous, just the work we've done in the last year has put a tremendous load on the grants team as we review and develop new policies and procedures for grants management. I'm not going to say there's been some overtime after listening to the first item, but there's been a little bit of overtime because it's tough to manage all of those balls in the air at the same time. Whether or not it results in a request for the legislature to consider in a budget, I think will be left to future discussion for us as we dig in and really figure out the efficiencies that we can eke out of the system and those that we cannot.
Well, just as long as there was no paid leave before, during the pay period, we're just fine with that overtime.
Duly noted.
But thank you for the job that you're doing, Mr. Superintendent. And again, on behalf of a lot of Nevadans who benefit from public education, including me and my children, I know you do an awful lot with a lot less than you'd like to have. And just keep up the good work. Thank you.
Thank you, Mr. Lieutenant Governor. Any further questions from committee members for the superintendent? Thank you.
Thank you, sir.
Let's move to agenda item number 5, which is another information item for the 6-month follow-up status reports. We've been going for some time, so Mr. Lohman or Mr. Weinberger, with respectfully, if we could move through these, we'd appreciate it.
Thank you, Governor, members of the committee. For the record, Warren Lohman, representing the Division of Child and Family Services, is Administrator Kelly Wooldridge and Deputy Administrator Kara Paoli. The division has partially implemented both recommendations from our February 2017 audit report. The division is making sub-grants from its $11 million System of Care implementation grant, as well as asserting leadership within the community of providers to implement our recommendation and transition state-provided specialized foster care treatment group home services to community-based providers when cost-effective. The division reports continued efforts to expand community-based providers, to monitor the need and efficiency of state-operated treatment group homes, and to coordinate policy with Clark and Washoe counties. The division anticipates diminishing the reliance on state-operated facilities and expects to fully implement the recommendation by September 2019. The second recommendation is to stratify licenses for specialized foster care, treatment group home, community-based providers is partially implemented as the division works to develop a strategic plan and sustainable funding that ensures children's needs are met across the acuity spectrum. The division reports working with Clark and Washoe counties and the Division of Healthcare Financing Policy on program and funding issues. The division expects to fully implement this recommendation by September 2019. This concludes my overview of the 6-month follow-up.
Thank you, Mr. Lohman. You read fast. Do you have any concerns with regard to the agency's action in that 6-month follow-up?
No, Governor, do not.
All right, well, if you're good, I'm good. Any questions from committee members? Ms. Woolridge, any issues for you?
Sorry. For the record, Kelly Wooldridge, Administrator for the Division of Child and Family Services, and as Mr. Lohman indicated, this is part of our larger strategic plan for our System of Care implementation grant to not only increase access to services for kids, but also improve the quality of services for kids and families, and we are right on track.
Thank you. Any questions from committee members? All right, thank you very much. Let's move to the next item, 5B, the Office of the Secretary of State. Mr. Lohman.
Governor, members of the committee, for the record, Warren Lohman, representing the Office of the Secretary of State, our Chief Deputy Secretary of State, Scott Anderson, Deputy Secretary of State for Operations, Cadence Matievich, and in Las Vegas, Deputy Secretary of State for Securities, Diane Foley. We made 3 recommendations in the February 2017 audit report of the Securities Division. The office has fully implemented 2 of the recommendations: to modify statute to designate a portion of registration fees to fund enforcement operations, and to modify statute to exclude penalties and fines from funding enforcement operations. The intent of both recommendations was achieved through the budget process rather than specific changes to statute as recommended in the audit. The office has partially implemented the recommendation to improve documentation and monitoring of enforcement cases and is working to modernize the case management system. The Securities Division expects to fully implement the recommendation by July 2019. This concludes my overview of the 6-month status report.
Okay, and this will be a pattern, but Mr. Lohman, are you satisfied with the 6-month follow-up?
Yes, Governor, we are.
Okay. Any comment from the Secretary of State's office?
Thank you, Governor. For the record, Scott Anderson, Chief Deputy Secretary of State. We want to thank you, the audit staff, for the tremendous work that they did, and also the Governor's Office of Finance for supporting the legislation that allowed, or the support of our budget request that allowed us to comply with numbers 1 and 2. And we are happy to report that we are well underway, much further along than our report has reflected, in that we are complete with phase 1 of our modernization of our case management tracking system, and well underway with the development of phase 2. So we're ahead of schedule.
All right, thank you. Good news. Any questions from committee members for the Secretary of State's office?
Governor,
Yes, Mr. Lieutenant Governor.
I just wanted to make a comment. Madam Secretary had to leave, as you know. She asked me, though, to thank Mr. Weinberger personally. He's been, and his staff, terrific to work with, and she appreciates his help and professionalism, and said that she was looking forward to the next audit on the election division. Thank you.
All right, thank you very much. Next item is 5C, Office of the State Controller.
Governor, members of the committee, for the record, Vida Ozude, I'm presenting our follow-up of the Office of the State Controller, Vendor Management System Services. Representing the office is James Mack, Chief Deputy Controller. We made 2 recommendations. One is fully implemented, and the other is no longer applicable. Our recommendation to provide DocuSign training to all vendor desk employees is fully implemented. The office negotiated a new contract which included 1-year online training. Access to the training was provided to all vendor desk employees. In addition, the office plans to schedule classroom training in DocuSign in Las Vegas for all agencies willing to participate in fiscal year 2018. The recommendation to reduce DocuSign envelopes purchased is no longer applicable. Due to the new contract negotiated for fiscal year 2018, reducing the number of envelopes purchased below 5,000 envelopes would double the cost per envelope. We would like to thank the office for their cooperation and assistance during the review. This concludes my presentation.
Thank you. Any comments from the Controller's office? Mr. Schmack.
Just to thank you to Vida and to Director Weinberger and the rest of the audit team for all of their assistance, and this was very helpful. It's always good to review our processes and see where there can be some new efficiencies, and this was a great experience in that. Thank you.
Committee members, any questions for the Controller's office? Mr. Treasurer.
Thank you, Governor. Just a quick question. What was this going to be used for? This is DocuTel or DocuSign?
Thank you. James Smack, Chief Deputy Controller, to the Treasurer. DocuSign is used as an automated way for vendors to submit their information as opposed to doing it manually by fax or by mail. So they can submit their W-9 information and all that information that we need, that we require as the state in order to register them as a vendor with the state for.
Well, I understand that, but what was this? This was a new program that you were implementing, or?
It was a program that we had already implemented.
Right.
We had already implemented, and one of the recommendations was to negotiate a contract with DocuSign to try to reduce the number of envelopes we're paying for. But the way DocuSign works, they give us a volume discount for 5,000 envelopes. If we order any envelope, which is basically comes out right now in this fiscal year 18 contract at $3 per envelope. Any smaller amount, like the recommendation was to go to about 3,500 envelopes, which was closer to our usage, would be at the per envelope price of $6 per envelope, which is what any envelope over 5,000 would cost us now. So if we reduced it to 3,500 at $6 per envelope, we'd actually be paying more. So we didn't figure that would be a prudent move on the part of our office.
So you're keeping it at 5,000?
Yes, sir. And additionally, we're trying to find some additional uses within our office to utilize more of the envelopes, get closer to that 5,000 mark. But yes, we're keeping it 5,000. It's the best overall value right now for our office.
Good, thank you. Good work to you and Mr. Controller.
Any other questions for the Controller's Office? Thank you very much. Oh, I'm sorry, I didn't see you, Mr. Controller.
No. I was to tell him something at the side.
Oh, all right. Thank you, Mr. Schmack. All right, let's move on to agenda item 5D, which is the state procurement process. Please proceed.
Governor and members of the committee, for the record, Vito Azude, I'm presenting our follow-up of the Purchasing Division State Procurement Process 2. Representing the division is Jeff Haig, Administrator. Our 5 recommendations for the audit are partially implemented. The first is to establish criteria for solicitation waiver eligibility. The division established criteria in coordination with the Office of the Attorney General. The criteria will become part of the automated checklist to be implemented in the state's e-procurement system, which will be available to agencies in April 2018. The second is to include the criteria in legislation or SAM. The criteria is currently undergoing review prior to being included in the division's procurement manual, which will be linked to SAM. A draft of the procurement manual will be presented to the Board of Examiners for approval in March 2018. Third is to include supporting documentation and agency head authorization requirement in SAM. The divisions revised the procurement manual to require agency head authorization. Agency head authorization will be automated in the state's e-procurement process, which will be available in April of 2018. The fourth is to modify NAC to allow waivers for commodities. The division hired its own in-house counsel, and they are working with the Office of the Attorney General to allow waivers for commodities and anticipate full implementation by July 2018. The last recommendation was to track expenditures made to vendors. The division represents this will be incorporated into the e-procurement system, which is anticipated to be operational in April of 2018. We would like to thank the division for their cooperation and assistance during the review. This concludes my presentation.
Thank you very much. Mr. Haig, so the response was 6 months ago, so it's been a year. And in the letter, it indicates that you we're looking forward to completing the recommendations by February 2018, which is a couple weeks away. So where are you post July 7th?
Thank you, Governor. Jeff Haig for the record, members of the committee. So as noted in Vita's comments, the additional criteria have been created. They're done. They were done shortly after the initial audit meeting. We're waiting. We've made the decision to wait to allow us to automate this process through the state's new e-procurement system. We felt that that would provide greater controls and insight into this process. And although disappointed this isn't live as yet, I think the product that we will be rolling out will be much better, will be much more user-friendly, and we'll have a higher degree of confidence that, that we're following the process as designed.
And when do you expect it to go live?
So this has changed a little bit. The system, aspects of the system went live in December of last year. The vendor self-service portal went live in December. The e-procurement system will go live to state purchasing on January 23rd of this month. We were shooting towards an April 2018 go live for state agencies. And in going live on April of 2018, it would have been without integration into the state's financial system and would have required some manual practices by the state purchasing team to be able to facilitate what we need out of this technology and coincidentally to be able to deliver on the audit reports that we're discussing this afternoon. We've been working with the controller staff over the last couple of months on a potential integration into the state's financial system Advantage. And just on Thursday of last week, we concluded with the technology provider, the controller staff, and state purchasing that we can integrate into Advantage with a very routine integration, no customization. And by doing that, we will allow what's referred to as a full rec-to-check process within the e-procurement system. But basically that automates the buying process from start to finish. And that integration would alleviate the manual entries that would allow us to capitalize on recommendation 3 here, which is to track more vendor data and expenditures. So it would be, the tentative timeline for full integration with Advantage would mean that e-procurement for state agencies would not go live until July.
Thank you. And then just for purposes of the record, REC is REC, not WRECK, correct?
That is correct, Governor.
All right. Any questions for Mr. Haig? Okay. Thank you. Thank you. All right, let's move to 5E, which is the Department of Administration, report number 17-04. Mr. Lohman.
Governor, members of the committee, for the record, Warren Lohman, representing the Department of Administration, and EATS are Shannon Ramming, Chief Information Officer, and David Hawes, the Deputy Administrator of the division. We made 4 recommendations to improve the technology investment request, TIRE, review process. All 4 recommendations are partially implemented. First, we recommended EATS broaden the TIRE review to include subject matter experts. EATS reports subject matter experts will become involved in the process to include assessing and rating TIRE submittals from agencies. EATS anticipates fully implementing the recommendation by the end of this month, January 2018. Secondly, we recommended EATS formalize policies and procedures for TIREs. EATS reports TIRE policies and procedures were being modified and formalized, including use of a new form, the Technology Investment Notification, or TIN, that agencies will be required to submit to start the TIRE process. EATS anticipated fully implementing this recommendation by the end of last month, December 2017. Third, we recommended EATS update the applicable NRS, NAC, SAM, and EATS TIRE instructions to reflect the changes in policies and procedures and better define requirements for the agencies. EATS reports the NRS revised wording is in review and the formal procedures required to revise the NRS, NAC, and SAM sections will begin after finalization of the TIRE policies and procedures. EATS anticipates fully implementing the recommendation in July 2019. Fourth, we recommended EATS collect summary data from all TIREs and TIRE waivers to help identify enterprise-wide opportunities. EATS reports that a SharePoint website has been created to capture and store TIN and TIRE information. This information will assist in identifying enterprise-wide opportunities. EATS anticipates fully implementing the recommendation in July 2019. This concludes my overview of the 6-month follow-up.
Mr. Lohman, you're satisfied with the progress?
Yes, Governor, we are, and with all of this as it's pushed out a bit, time will tell, but at this point, we're very confident in the direction that Director Cates and Ms. Ramming has taken, and we think we'll be fine.
Thank you. Any presentation from administration?
Great, thank you. First of all, my name is Shanna Ramming. I'm the Chief Information Officer here, and I want to thank the Audit Committee very much. This has been a great audit, and it's wonderful to have the technology investment request have some look at it, and we're very excited to go there. We actually are on point, and we are on track. In fact, with number 4, we're almost already done, and that's supposed to be for July of 19. So we already have our subject matter experts going through and looking at all of the technology investment requests. We also have submitted all of our procedures for the budget book, which needed to be submitted in December, and we are right on track.
Thank you. I always like having great and audit in the same sentence, so that's good. All right, questions from committee members? I hear none. Thank you. We'll move to agenda item number 6, which is approval of the division's annual audit plan pursuant to NRS 353A.038. Mr. Weinberger.
Thank you, Governor. For the record, Steve Weinberger. So we're requesting one new audit, and we have a status update on some of our audits going on right now. This does supersede the audit plan that was in the October book. And we didn't actually request any audits in October. It was just kind of moving things around. And it was based on the request to move up the boards and commissions audit, and that's scheduled to be presented this June. So this is an action item. The committee may wish to request additional audits or revise the schedule.
All right, are you at full capacity right now with regard to your audits, Mr. Weinberger?
Thank you, Governor. For the record, Steve Weinberger. Yes, we are. We had 2 vacancies. Just filled one of them. In fact, today is his first day. We have one other vacancy.
I was wondering. I saw you sitting back there
I'll
quietly.
introduce him, Craig Stevenson. Today is his first day.
Congratulations.
He's an executive branch auditor, too. We do have one other vacancy. Recruitment should end in about a week, so we're hoping to get back up to full staff as soon as possible.
Thank you. Okay, questions or comments from committee members on agenda item number 7? Mr. Controller.
Thank you, Governor, and I have no problem with the revised audit plan that we've been presented, but except one. Earlier today, when we were talking about the GOED audit, I requested that it be put over based on a request I made to Mr. Hill, and that he said he would provide information. And Governor, you said that that request, that issue was outside the scope of the audit. The problem we therefore have right now is how shall a board member know the scope of the audit if it's not made explicit? And I don't see it made explicit here. And so, so that we don't have those kind of problems in the future, how can we handle that and have a clear understanding by each member of this 7-member committee as to what it is we're approving and what we can expect?
Thank you, Mr. Controller. Steve Weinberger for the record. So on the GOED audit, I think it was discussed, the scope was. In fact, I even issued a letter to everybody on this committee and specifically said it was limited to those 2 statutes that dealt with the Faraday and the Tesla projects. If we have an audit requested of us, for the most part, we know what our scope is because it's based on the request. If I pick an audit just off of my risk assessment, then it's open scope. So it's really hard for me to say right now we're going to audit a huge department and tell you exactly what our scope will be if it hasn't been discussed and it hasn't been part of a request.
And I certainly appreciate that, having been not the victim, but the beneficiary of that process where, at the governor's suggestion, you came to me within the first week that I was in office and said, would you like to be audited? And of course, like any normal human being, I said, what? And then it took about a nanosecond to say, hey, what a blessing, and say, yeah, come on in and cover everything. And well, you weren't quite able to do that, but you focused on the important parts. I guess if you're putting together the audit and trying to find out where the issues are and where the productivity is in the audit, you're going to have to do that as you go. I still do have this problem in that I thought that the question that I asked about how could the public reassure itself, get the right information, and be able to make its own judgments about a matter such as GOED's efforts and its successes. I still think that's a reasonable one, and I'll just say I'll vote to approve this, but at some point we need to, especially on requested audits, we need to have a clear statement so that we don't run into a misunderstanding and a misapprehension. Thank you.
All right, if there are no further questions or comments, and I believe a moment ago I referred to agenda item 7, I meant agenda item number 6. Is there a motion to approve the division's annual audit plan pursuant to NRS 353A.038 as presented in agenda item number 6?
Move to approve agenda item number 6.
Attorney General has moved for approval. Is there a second?
Yes. Second.
Second by Lieutenant Governor. Any questions or discussion on the motion? I hear none. All those in favor say aye.
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 Those opposed say no. That motion passes unanimously. We'll move on to agenda item number 7, which is approval of the division's annual report released September 30, 2017. Mr. Weinberger.
Thank you, Governor. For the record, Steve Weinberger. So this is our annual report for 2017. It details our accomplishments and performance measures. It's split up into 3 sections: executive branch audits, our financial management section, which is mainly training, and our compliance review section, which they do more compliance type reviews. And I guess with that, I'll answer any questions that the committee may have.
Okay. I have no questions, just a compliment to your whole staff. I mean, I think you guys do wonderful work, and it's incredibly beneficial, and the results that you achieve for the state are monumental. So there's always room for improvement, and you find all the time, and I think that's a great accomplishment. So I think I speak for all the committee when I say job well done. Thank you.
Governor, I move to approve.
All right. Attorney General has moved to approve the division's annual report released September 30, 2017, as presented in agenda item number 7. Is there a second? Second. Second by the Controller. Any questions or comments on the motion? I hear none. All in favor say aye. Aye.
Aye.
Those opposed say no. That motion passes unanimously. We'll move to agenda item number 8, which is an information item. Presentation of the estimated benefits to Nevadans. Mr. Weinberger.
Thank you, Governor. For the record, Steve Weinberger. One of our performance measures is basically a rate of return. When possible, we calculate the value of our recommendations if fully implemented. They're estimates, of course. And we're at $65 to 1 right now, and this is the support for the $65. And I can answer any questions the committee may have.
Thank you. And same comment. Great work. I mean, it's obviously a massive savings to the people of Nevada, so I truly appreciate it. Other comments? Mr.
Just a
Treasurer.
question. Could you just repeat what you said? $65?
Right. What we do is we accumulate the estimated dollar benefit of our recommendations, and we take our cost for the annual
Okay, I get it.
year.
I get it. Thank you.
Got it. Rate of return. Yeah.
Mr. Controller.
Thank you. Is that a 65 to 1 ratio?
Mr. Controller, thank you for the question. That's correct. So for every dollar spent on us, the estimated benefits are $65.
Are you suggesting by that that's the embedded ratio? I understand that's the ratio of what we've spent versus the results we've seen. Are you suggesting by that it is also the marginal ratio, and that for every new dollar you get, he'll also produce $65?
Thank you for the question, Mr. Controller. I'm not really suggesting anything. That's just based on our history.
Okay.
And again, it's kind of funny because when I did my presentation to the legislature for my budget, I was questioned on this. And I did a lot of research to see what other audit shops do. And we're the only one that I actually found where we don't take credit for something unless we can verify it was implemented. Everybody else accumulates what they call identified savings, which means you've identified it, but it doesn't mean that you've verified it was implemented.
And an example of that would be the question that I asked Ms. Bregan about earlier today, which is, so there's 7.4 potential savings, but how much can we expect? And the answer would be, we don't use the 7.4, we use what's documented after the fact.
No, actually, well, better example would be to use your audit, the collections audit. We had identified several $1 million in that, but to date, we haven't verified they've been implemented yet. So we're not, if you look at my schedule, I'm not taking any credit for any of those estimates, where other shops call it identified and do take credit for it.
That's good practice, sir. Thank you.
Thank you.
And any further questions on agenda item number 8? Let's move to agenda item number 9, presentation of the status of the division's outstanding audit recommendations. Mr. Weinberger.
Thank you, Governor. For the record, Steve Weinberger. This is self-explanatory. These are some of our outstanding recommendations. By statute, we have to go out in 6 months and follow up on these. And then after that, we try and hit these annually. And these are the ones that, as of June 30th of last year, have not been fully implemented.
Okay, any concerns for you in there?
You know, it's a challenge for us because when it comes to our resources, this is probably the lowest thing on our priority. But I always make an attempt somewhere throughout the year to take at least one auditor and assign them to nothing but following up on these old recommendations. Some of these become no longer applicable. And some of these recommendations, surprisingly, you know, we go 2 or 3 years where it looks like nothing's going to happen, and then all of a sudden something breaks, and we get closer to actually fully implementing these.
Committee members, any questions with regard to agenda item number 9? Let's move to agenda item number 10, presentation of the division's audit risk assessment. Mr. Weinberger.
Thank you, Governor. For the record, Steve Weinberger. We're subject to the standards of the Institute of Internal Auditors, and one of the standards requires us to basically disclose my risk assessment to the committee, and that's what this is. It's based mainly on budget numbers because that's kind of our main objective, is to try and save money for the state. So that's how it's weighted. I also have some information regarding hotlines too, where if I see something that warrants us getting in there right away, I'll go ahead and give it a high. Medium is sooner than normally scheduled, and then low ones are, it's an item we'll consider at our next scheduled audit.
Committee members, any questions with regard to agenda item number 10? Mr. Controller.
Thank you. In your answer just now, Mr. Weinberger, you mentioned basically costs to the state. Have you given any thought, do you think you have any way of looking at value to the state and value to the taxpayers of things that might not show a cost reduction but a performance improvement?
Actually, I do kind of have a catch-all. And if I mentioned specifically the hotline, but if something else comes to our attention through a different avenue, I would definitely put some weight on that and try and get that audit done sooner than scheduled.
Thank you.
Any other questions with regard to agenda item number 10? Move to agenda item number 11, committee member comments. Are there any committee member comments? Hear none, let's move to public comment. Is there any member of the public present in Carson City that would like to provide a comment to the committee? Mr. Wells. Okay, just a moment, sir. After this gentleman speaks, if you would come forward. Yeah, thank you.
Good afternoon, Governor, members of the committee. For the record, Jim Wells, Director of the Governor's Finance Office. And I just wanted to clarify a couple of things that were said earlier under the audits. Specifically for the Medicaid audit, the percentage of the general fund that is relative to the total funding for Medicaid. So the state invests about $700 million to get a $4.1 billion budget. So we're about 17% of the funding is state money. The other 83% federal money, and that's because there are different breakdowns of percentages of federal share depending on the population. So the children under the Children's Health Insurance Program is right now at 98%. The new eligibles are at 94.5%, and most of the rest of the population is at 66%. With the administration, it's split either 50-50 or 75-25. So that's kind of the breakdown of the state versus federal cost as it relates to the Medicare. So it's not a 1/3, 2/3 split.
So just the bottom line then, what is the state's contribution to Medicaid?
In FY18, the state's contribution is $681.5 million.
So that's considerably less than 1.5 that I thought.
That's why I wanted to make sure that was put on the record.
Thank you for that correction.
And then the second thing that I will put on the record is relating to the Department of Corrections audit, and we will be creating a technical assistance team to work with the Department of Corrections on a corrective action plan to get that under control. It'll be consist of people from my office as well as the budget office as well as the internal audits office, and we have a meeting scheduled on Friday, so that's kind of the kickoff of where we are. We'll get
Obviously, Mr. Wells, it's all hands on deck when it comes to that one. Thank you. All right, sir, if you would come forward and identify yourself. Steve, would you help him with?
My name's Keith Young. I have some questions regarding the SISMOD project. First question is, I'd like to know how it was funded. Is it from the highway fund, the general fund? How's the funding for that?
Sir, this is public comment, so if you do have questions, we'll be happy to put you together with somebody to respond to those questions.
Okay, because I wasn't familiar how this went, so.
Yeah,
it's my
understood,
first time,
sir.
so.
And so if there are specific questions that you have, we'd be happy to put you together with somebody to respond
Okay,
to
because
them.
most of mine are questions, so.
Okay.
So if that's the way we'll do it, that'll be fine.
Yeah. So perhaps, trying to look, maybe Mr. Wells, if you could get a copy of, is it Mr. Young, correct?
Yes.
Yes, Mr. Young's questions, perhaps we could have somebody in my office or your office respond to them.
Okay.
Thank you, Mr. Young.
How do you turn that on? Thank you.
Are there any further, is there any further public comment from Carson City? I hear and see none. Any public comment from Las Vegas, Mr. Lieutenant Governor?
None here, Governor.
Thank you. Agenda item 13, adjournment. Is there a motion to adjourn? The controller has moved to adjourn. Is there a second? Second by the Attorney General. All in favor say aye.
Aye.
Aye. Those opposed say no. This meeting is adjourned. Thank you.